setting up the new meeting?
It's already set up. We had already set it up, but the way that Zoom works is you can't start a meeting and a webinar at the same time.
So you can notify them right now with the new stuff?
Yeah.
Okay.
Did you have something open? Did you want to? Do you want me to
no,
send
I
you?
don't have the stuff though. I don't have the new link.
Here, I'll give it to you.
Well, I don't have much capability because they don't give me a mouse. So no.
Okay. Okay.
We need to send it to staff too. Try to separate them.
Let's see here.
I'm just replying to the appointment on Outlook.
Okay.
That will capture everybody.
That's what I was going to do. Okay. So. Okay. Having them email me if they have any issues, but otherwise I'm just saying, please use this. We had a minor scheduling glitch this morning.
Monica and Jackie, everybody, nice to see you. We are waiting for one more commissioner to join us, and then, and I know there's Shayna. Okay, so we can go ahead and get started. Sorry, we had a bit of a technical difficulty this morning and needed to change URLs. So we know for sure that Myra, good morning, Myra is on a different commission call, not our commission, different commission call, but will be joining us shortly. So she said she, and we know Molly is joining us from Minnesota, like George. Our satellite offices in Minnesota, I guess, today, but she will be joining us shortly, I'm sure. So we'll go ahead and get started. Do you want to start by George? You want to call? I don't have that. Oh, George, you want to call the meeting to order?
I think that's probably a really good idea.
Okay.
I will officially call this meeting to order. I thank everybody hugely for being on the meeting, for doing this work. This is an important time for us to do this. We're in a time of change, time of trauma, a time of churn, time of opportunity, and we and everybody need to think through what we are doing, how we are doing it, directions we're going, use of money, use of resources, priorities and interactions. I have been doing a bunch of work in the last few weeks on universal coverage, health coverage. So I've been working with both parties. I've been working with administration. I've been working with a couple trade associations, a number of organizations, and basically arguing that this is the right time, since we've got this COVID mess, And we've got all of these terribly, terribly damaged care systems. And since we are now absolutely clear about how disorganized care is and how unconnected care is, and the fact that we don't have data flow and care, the whole country suddenly is exposed to the inadequacies of the current system in those levels, and beginning to appreciate for the first time all of the people who had the urban legend belief that America had the best care in the world are now getting a good sense that that is absolutely not true. And we not only don't have the best care in the world, we have in many cases some really inadequate and clearly unconnected care. So I've been working on the issues of universal coverage for everybody. We've gotten into half a dozen news media. Forbes wrote an editorial in favor. Financial News Report wrote an editorial in favor. I mean, and people like it. But the reason that I'm mentioning it now is that one of the things that I talk about in all of those proposals and interviews is early childhood brain development. And I talk about the horrible disparities we have on death rate for African Americans in this country on COVID. And I'm on 2 COVID coalitions, and I've looked at the data. And the COVID coalitions, people are dying at a much higher rate if you're African American, not because you're racially African American, but because of comorbidities. The data from New Orleans, the data basically shows that when you've got a higher rate of diabetes, when you've got a higher rate of asthma, when you've got a higher rate of heart disease, and you get COVID, you're 3 and 4 times more likely to die. I mean, 80% of the people with comorbidities that go into some of the hospitals are dying, and they're dying because of the comorbidities. So people without comorbidities are surviving. So we go back and look at the comorbidities. Why is it relevant to us? It's relevant to us because we know if the kids are behind by age 3, at age 3, they are 3 times more likely to be diabetic. We've got the data. We know even in our old care system, even when the patients had the same doctors, same treatment, same everything, African-American woman who had dropped out of high school was 3 times more likely to be diabetic than someone who graduated from high school. And we know by age 3 which track they're on. So all of those comorbidities and that higher death rate goes back to 0 to 3 and goes back to stuff that we are working on as a commission. So it's part of the overall fabric, and we need to be aware of it and looking at it as we go forward. And so that's one point. Second point is Aaron Price did a magnificent thing of sending us all of our historical information that reminds us of why we are here. And one of the things that he sent was the actual act, and that formed First Five. And when you go back and look at the very beginning of that act, and you look at the clarity of that act, what the act says is, it is the intent of the act to ensure that children are ready to learn when they enter school. That it literally entering learning readiness was not only in the act, it's foundation of the act. So it doesn't say that First Five exists to make sure all kids get diapers, or that caregivers end up being paid a fair wage. What it says is First Five exists, literally exists, to ensure, quote, to ensure that children are ready to enter school. And so the learning readiness stuff, and then it says, and commission shall use outcomes-based accountability to determine future expenditures. So outcomes-based accountability. So a couple of years ago, we looked at that. A couple of years ago, we basically did the survey work to identify that 90% of the low-income mothers in California did not know they could exercise their kids' brain and strengthen the brain. So we set a goal. So we did exactly this. We did an outcomes-based goal, and the outcomes-based goal was that we were going to get to 90% of the mothers knowing that. So we did the Talk, Read, Sing campaign. We spent a bunch of money on it. And Talk, Read, Sing, we actually got to 87%, I think, of the mothers. So we flipped it from 90 not getting it to 90 getting it. We had Diana Dooley and Tom Porlix and everybody on board with that. Camille, you remember the big announcement we made at the summit? We made a big fuss out of it and got all the stuff. And then we went down that path. And that's an outcomes-based accountability that we spent money on. And it was a clear public health agenda that we set up to get to that 90% awareness, and we did it. And then we said we want to get to 80% of the families with books, because when the 90% knew it, but only half of them read, we went back and looked, and what we discovered was that half of those homes don't have a single book. So the reason that they're not reading, you can't read without a book. And so we saw, okay, here's the hole in the fabric. So we need an outcomes-based accountability. So we worked very cleverly, carefully with, little by little, we put together a program. We got 2 books into those homes, and in those homes, we got up to 60 to 80% learning readiness in a couple of those school districts when they got homes and books. So we were on path to do the same thing that the Act calls us to do, outcomes-based accountability for kids, by getting 80% of the low-income homes with books, and that got killed. Now, the governor loved it. The governor really wanted to do that. He was very clear about that. They basically, he told Chris in my presence to make it happen. And so we got partway down that path, but then we didn't get further down that path. And now we are way behind on that path. And so the reason I'm setting that up is, as we look at our use of resources, I think that we need to go back and look at that. It is the intent of the Act that we ensure that children are ready to enter school, and that we figure out, the second part of that sentence, we figure out outcomes-based measurements to get there. And so I think we need that as a context for our thinking and discussion. And with that, I will ask Jamie to call the roll of the commission. Jamie, would you please call the roll?
Lara Alvarez,
Here.
Buntu Davis, Monica Fitzgerald,
Here.
George Halverson,
Here.
Shayna Hazen,
Here.
Molly Munger, she's logging on momentarily, so we'll check in a minute. Jackie Majors,
Here.
Chris Perry,
Here.
thank you.
Okay,
Okay, with that, I'm going to hand the agenda over to Camille and ask Camille to take us into the official announcements. A couple announcements. One is conflict of interest. Let me read the statement. Please let me know if any agenda item presents or potentially may present a conflict of interest for you. Obtaining this information in advance will ensure that I can ensure your non-participation in any aspect of that item in compliance with applicable laws. So with that, does anybody want to declare any issue today of conflict? Hearing none, I will then say, for public comment, members of the public may speak up to 3 minutes on any non-agenda item or items not related to pending judicial, administrative, litigation, or personnel matters. No action by the State Commission may be taken on the public comment. If you wish to comment, use the raise hand function. Now, this is a new part of the script. Use the raise hand function or the chat function if that is not available on your computer. Jamie will call on the public in the order in which they signed in if we have public comment, and I assume we will because we usually do. So with that, Camille, may I hand the gavel over to you?
yes, at this point, George, to public comment on non-agenda items, there is no one signed up at the moment to speak.
I would like to note that I have been listening. I heard part of the roll call, but it's taken me a while to enter. So here I am, finally.
Good.
Sorry.
Welcome.
Oh, actually, since we said that, someone has raised their hand for public comment.
Melissa Stafford Jones.
Melissa Stafford Jones. And so Before Melissa comes on, I would just like to introduce you, commissioners, to the new executive director of the First Five Association. Here she is, Melissa Stafford Jones. We're excited. I've had the opportunity to work with her over the last couple of weeks, and she is jumped in with everything, not only to come up to speed, but also to take on that leadership role. And so we're thrilled she's here. Melissa, I'm going to let you have a few minutes, and here's the commission. So.
Good morning, everyone. It's wonderful to be here with you. Thank you so much for having me for a few minutes and the opportunity to join you today. I want to thank Camille for her partnership already. I am in these first few weeks, and so I'm really grateful to be able to be here with you today and to have the opportunity to start working with the State Commission, with Camille, with the team. So thank you. And thank you for the discussion I know you're having today and for all the work that has been happening, particularly related to COVID response and recovery and the impact it's having on the children and families that I know we all care so deeply about. I wanted to just share a few thoughts with you today and mostly introduce myself and really set the stage for what I know and hope will be a really collaborative, wonderful partnership going forward on this critical work. As you know, the county commissions across the state are really steeped in the COVID-19 response efforts in many ways, setting up pop-up childcare for essential workers, really ensuring during this time that the needs of our most vulnerable children and their families are identified and responded to and focused on and addressed, such as delivering home visiting through virtual methods, conducting virtual developmental screenings, connecting parents to appropriate care, helping families navigate public systems and connecting them to resources that they may need, and then working with local partners on campaigns to address and try to prevent child abuse, which we all know is elevated during any disaster and particularly during this extended period of stress and strain on our families. And of course, also delivering concrete emergency supplies, both purchased by First Five California, thank you for your leadership and partnership on that, and by a number of county commissions as well. I wanted to share the thought today that one of the things we have really seen through the COVID emergency response work is the highlighting of two critical structural issues and components of our shared work that I think really embody and reflect our shared purpose and how our collaboration and partnership as a First Five network are so essential. And the first, of course, is the inequities that have been laid bare through the impact of COVID-19. We all know that COVID-19 has exposed deep structural, racial, and economic inequities that of course long existed in our communities and in the historical architecture of systems that serve children and families. But we are seeing more starkly and really COVID-19 has deepened these inequities, both from a racial perspective and economically. And you know, we all know we see this most in communities of color and the impact on Black and brown children and families, hardest hit both by the health impacts of COVID-19, but also the economic crisis that has resulted. The other, I think, overall reflection from this time is really how important coordination is and how we've seen that emphasis during this time and the coming together that we've seen. Coordination and collaboration, of course, have never been more critical. The field and our families will continue to suffer from duplication and disconnected systems, and we know it's our work to tackle that. And First Five commissions are working very closely with R&Rs and with APs to support the childcare workforce and help address families' needs. We're working with family resource centers to support parents during these incredibly stressful times. We're working with healthcare partners to help promote and connect families to an array of regular and preventive care services. And through all of our collective efforts and as the backbone of these efforts and systems at the local level, we've also seen how the pandemic has highlighted how First Five California is our closest and strongest partner, how together this partnership is the basis of that backbone role that together we create for early childhood systems in our state and in our communities. Our collective Prop 10 mandate is to create an integrated, comprehensive, and collaborative system of information and services to enhance optimal early childhood development and to ensure that children are ready to enter school. We know this requires partnerships, both state, local level networks and across sectors to have the whole child, whole family framework that we need. So we hope to partner with you as these critical conversations advance to ensure we do our part in meeting the moment that is before us and continue to build upon the strength that is the state's first 5 local network partnerships. So thank you. I appreciate the opportunity to be with you today and to share some opening thoughts.
Thank you. Thank you. Thank you. Much appreciated.
Thank you.
Yeah,
Thank you.
one of the things, we are so much stronger. I used to do some lobbying with the American Hospital Association. And anytime we went to Congress and we brought in the National Association, but then we also brought in each of the states, the impact was so much greater when we had the state impact there. And our impact, California, is so much greater when we go as first 5 state commission, but when we go as each of the counties have trusted leaders. They have people who got into those positions because they were chosen by the infrastructure of each county to be in those leadership positions. And so you're starting with the right people. And when you get that combination of right people all coming together in each of these settings, both with the administration and with the legislature, that's a huge, huge power. And to be splintered in that space is just silly, and to be together is wonderful for kids. And I love what you're saying about the direction you want to go and what you're going to do. So, and if Camille says you're the right person, you are definitely the right person.
Thank you. Thank you. We're very dedicated to our state local partnership. So thank you.
Yep.
All right, thanks, Melissa, so much for taking time to do that. Right before I turn this over to Erin Price, I just have another introduction, commissioners, to you. I'd like to introduce to you today Marcia Bedwell, who is has come on board to help us with our as our attorney. She is replacing our good friend Frank Pertek as far as legal counsel goes. Marcia is former general counsel at California Department of Education. She's also worked in the private sector, has a wealth of knowledge, especially around obviously K-12, and is now getting steeped in early learning. So I don't know, Marcia, if we can we take her off? Just so you can.
She should be up there.
She's up there.
She has to turn her camera.
Marcia, can you turn your camera on? There she is. There we go. And you have to unmute yourself. There we go. So Marcia's going to be here. Yes, we can hear you.
Great.
She's going to be here to help us stay on the right path of Bagley-Keene and do all of those things that are necessary to do. So commissioners, this is Marcia Bedwell. I don't know if you want to say anything, Marcia.
Nice to meet you all, if only virtually. I think we're all struggling a little bit with this lack of close contact, but I am delighted to help the commission as it navigates this new territory. Child development, child care is a long-standing interest of mine, so it's a great pleasure.
Wonderful. Thank you. Welcome.
Thank you.
So there you go. So with that, the only other thing is I will say welcome to part 2 of the budget retreat. And I'm really so hoping there's no part 3. I'm hoping we can get through our agenda today so that moving forward, our goals of doing the level setting we all want to do so that we all are comfortable and feel informed of the work of First 5 California. Staff is looking forward to your discussions to get direction from you about proceeding as we move, as Marcia said, through this interesting and new way of doing business. So with that, again, our goal today is to get through a lot of material. So I'm going to let Erin Price take over and help us do that. So Erin, thank you so much for being here again.
Great, thanks, Camille. Hi, everybody. Great to be with you for part two. I'm going to go ahead and just share an agenda document here and briefly cover this before we continue on through the day. So zoom out and think back to almost exactly a month ago. I think June 22nd was the part one of this budget retreat, where we reviewed some background information about the Act, we reviewed some information about financials, and then we reviewed some information about current projects, which will continue that theme today, and had a important discussion last month about impact, as there was a time-sensitive nature to some of that discussion and what action might be taken. So with that, we have scheduled this part two of the retreat to really get into some of these other objectives that we maybe scratched the surface of last month, but didn't really go into in the level of depth necessary. So those two objectives that we have for today, for part two, before next month kind of serves as this transition back into more regular commission meetings, I suppose, discussing current and proposed investments and projects in light of COVID-19, the state's recovery efforts, and the First Five California strategic plan. And then directing First Five California staff to bring forward specific information and or proposals for future consideration by the commission. Looking at the agenda, I'm gonna pass it back in just a moment to you, Camille, for a couple of these updates on some of the items that came up in part one that are being followed up on outside of this part two of the retreat. We're going to take a look back at some of the slides, just kind of a refresher on some of those financial status slides that we looked at together in June, and provide some time for any questions, comments that you all may have on that, with the rationale that we weren't sure if there was enough time to get to everybody's questions and comments on that in part one. So we'll take a look at those and have any discussion there. We'll have some discussion of existing programs, and so some of you responded to a pre part two of the retreat survey identifying which of those you would want to discuss. So we have a list, and we'll hear briefly from First Five California staff, just a quick update on the status of those projects. We'll also put up on the screen, well, as we go through those, the relevant page from this document, this table of information about the different projects. And then as we go through each, if there are questions, discussion, we will have some time for that. We have quite a few projects, so that we may be a little tight for our time there, but we will work through it together. We have a break.
Quick comment. When at the beginning of the meeting, I talked about the fact that it is the intent of the Act to ensure that children are ready to enter school, right? We need that as a project. That's the Act. It's a point of the Act. It's the foundation of the Act. It's the floor of the Act. We need that as a project of some kind. We have to have a ready to enter school project, and we don't have that. We've got bits and pieces and a whole bunch of things that are kind of problematic about various current agendas, but the purpose of the Act to have children ready to enter school has to be there. So how do we get to that? And then how do we identify which portions of this money are going down that path? And a couple of them are. I mean, really quick example, the handbook we give out to all new mothers. That is a wonderful opportunity to teach that, to have kids learning ready by getting the talk, read, sing message into that. And we just did a new version of that, and we moved the talk, read, sing. We moved the learning readiness from page 42 to page 1. And so now when you get that book, you look at it and you can see that brain development is really important at birth, and you don't have to read 42 pages into our handout to figure that out. It's really clear, but we need to celebrate that, but we also need to reflect that as part of the plan. So we need to say, what is our learning readiness program, and how is that kid helping, and then how is the ad campaign helping? So I think we need to reformat this to reflect, Camille, do you have an idea of how you could do that?
Camille, you're on mute.
There we go. Sorry about that. I think as we go through the projects today, with that in mind, with learning readiness as part of that, in the same way at our last meeting, commissioners were very clear that they really wanted to ensure that our investments were serving those children who were in not only in poverty, but in persistent poverty, those hard to reach. Commissioners made it very clear. In that same way, I think as we, at this point, go through those things with a learning readiness hat on or a thought about that, to the end where, after seeing what this discussion brings out, then what do we need to add? And that is for commissioners to say, we really want you now to take this information, but we really want something around learning readiness. And that is for the commission.
Yeah, the commission needs to decide that. My sense is that because it is why we exist, I think it's literally why we exist, we need a goal. We need a project that says, what is our learning readiness goal? And then, to your point, there are several ingredients in those other programs. You know, I worked, really quick history, but I worked with the American Diabetes Association. We had the worst blindness levels from diabetes in the world. We had the worst amputation levels. And we said, that's crazy. What we need to do is go upstream in the process, and we need to change diabetic care, and we need to set some goals. And so we set basic goals of having every single diabetic have their blood sugar measured. And we actually got to that point. When we did, we cut blindness in half. But we need to do that on this. We need to have all the kids learning ready, because everybody has seen how terrible the literacy levels are in California, and they've gotten worse. And we have been existing as a commission for a decade to make those learning levels better. That was literally stated in the act, and we haven't moved that needle. So we need to move that needle, and we need an objective to do that. And you can rewrite it and move things into a single format, but we do need that piece in this agenda, even if it's just a report about how all of the other parts distill into that goal.
And I think, George, that there are different places where that does come up or can come up in today's discussion. I know certainly when we get to this after the break session on what more is needed or what is not addressed through the current projects, that is one of there's a few items that came up in some of the survey responses, and certainly that is one of them that we can have kind of on a starter list, talking about learning readiness.
And the starter list that begins with our mission, and the first goal of our mission obviously has some priority. Go for it. Yeah. So
that pretty much rounds out the agenda. As Camille, Fred will have that time for discussion of new ideas or requests for what should be brought back to the commission, and then we'll wrap up with some next steps just before 2 o'clock. So Camille, I'll pass it back to you just for a couple of quick updates here on these items at the top.
Right. So just quickly, commissioners, just to update you from the last meeting, we did go forward and revise the language in the grant award letters to really reflect that our priority was to serve, again, those children, those hard to reach children and families. especially those who who are living in persistent poverty. We ran that language by our program advisory committee, and then included it in that. We talked with counties about it, and I think there is clear, the language is very clear that's the priority for the work around impact. And we will be coming back to you as we go forward with impact to report on how that is working and how we are doing.
And Camille, in the phrasing of that, does that fit our mission of having the kids ready to learn? That's our number one goal. We should include that in that work and report.
Okay. I will, those, again, the grant award letters have gone out, but certainly this is an ongoing, our work is ongoing with our counties as far as impact goes, George. So certainly we will have opportunities to do that.
And just to add, absolutely, the learning readiness is one of the primary goals of Impact 2020 and Quality Counts California. So, so that's definitely embedded within the RFA, and the grant award notification is just what we ask counties to make sure they are doing in order to achieve the goals of Impact 2020 and use the funding most effectively. So, and good morning, everyone.
Good morning.
Good morning. Can I just ask, Erin, can you get out of share screen so we can see each other? I'm now staring at this agenda and I can't seem to have, I'd like to go back so that we can all see each other.
Sure.
Yeah, there you go. Thanks. That's great. I know we need to look at documents, but when we don't, it's nice to see everybody.
Yep.
And there should be a way for you to do both, Molly.
Well, what I got was I got a partial of the people, but not all of you. And it just, and I found I could click it. If I wanted to see everybody, I had to keep going up and down, and it was just not, yeah, I thought, well, whatever. Thank you for indulging me.
Sure. All right.
Okay.
Camille, did you want to share about the other couple items?
So the other item was around, one of the other items was around working on the presentation of fiscal information and how we could look at that and think about revising that. So we are, I've talked with Molly and George about really working with a couple of commissioners to really think about how that presentation and bringing some things forward to commissioners to in how we present fiscal information. Hopefully that will help inform you all in a clear and transparent way. So we are working on that. We're setting a meeting and are going to get to work, and that's how we're going forward with that. The other, I think, thing that you all talked with us about was staffing and how to look at alternative ways to get people on board. So as I introduced you to Marcia, that's, you know, we're excited to have her join us. Along with, we have a couple other retired annuitants who have come back and are doing some work for us, as well as we have 3 or 4 packages out right now with general services and getting ready to interview people to start to fill some of those spots. But again, looking also at other ways to recruit and folks into state service. I would say recruit and retain, but I'm not sure what we retain as far as, you know, putting forward, this is the best place to work ever. And our big perk is free parking, but now we don't come to work, so that doesn't work so well as it once did. But we're continuing to look at other places, talking with other agencies, even to see if they might be willing to have someone to even share time with us, you know, and looking as well at other places or other entities that might be willing to share employees that we could contract with for a while. So we are moving forward on that as well. And I think those were the 3 things that we were had a follow-up on, Aaron.
Great, thank you, Camille. All right, now move us into then just looking at some of the slides and a subset of the slides on the financial account balances and projected revenues and expenditures that we looked at back in June, and see if there's questions or comments and discussion that you all would all like to have. So I'm going to go back to sharing my screen for just a couple minutes here. So we're going to look at this chart in a couple of different universes. This is the universe of all First 5 California funds, and then we will zoom in on each account. And so what we're looking at here is the expenditures is this orange line. So 117, this is the fiscal year that just recently ended. So if we maybe look at 2020, 2021, expenditures of 113 million, revenue of 75, and then there's a previous balance carried over 137, and that framework, I guess, is applied then out to later years, where we've got this blue amount, which is the revenue in the year, the green amount, which is the fund balance that's the previous balance carried forward, and then the orange line is expenditure. So we can see in 1920, 2021, we have expenditures that are being funded in part through some previous balance, right? Higher than the revenue of that year. We come down pretty close to the total revenue, but still a little bit above in 21, 22, and 22, 23. And then as we get further out and there's less committed as well as under consideration expenditures, we reduce down to below the total revenue, as you can see there. The other piece of this framework is that for the total expenditure amount, we're showing down here how much is committed. So nearly all committed in 2021. The difference between a dash and a zero is a dash is actually zero, and a zero is some amount less than 500,000 as we're rounding to the nearest million. So we can see as we get further out, there's an increase in the amount that's under consideration here in this blue, this top row. So if we look at this on an account by account basis, for mass media communications, again, same framework. So if we look really at 2020, 2021, forward, we're just below the projected revenue for this account. And the majority of the funds after this current fiscal year are in the under consideration category as opposed to committed. Looking at education, we're here certainly above the projected revenue for the current fiscal year and slightly above for the next 2, and then dropping down so we can see kind of this stepping down of the amount of previous balance in this account. Here, it's nearly all in the committed row, except for when we get out to 23, 24. Okay, so that's education. Childcare, we have a significant reduction of the previous balance here over this time period that we're looking at, in particular based on expenditures last year and committed for this current year. And then coming down again, kind of a similar pattern of dropping down and then kind of staying even for 21, 22, and 22, 23, and then further reducing as there's not committed or under consideration funding proposals out to 23, 24 here, where there's few from a dollar standpoint compared to previous years. So that's childcare. R&D, we have a little bit of a different pattern here, expenditure-wise, kind of the same shape, but coming down to below projected revenues. So the previous balance is utilized to a certain extent in this step down, but then is coming back up in these later years. Most of the funding here in committed, though some starting next fiscal year and beyond in under consideration. It's our R&D, a couple more here. Unallocated, more of an even expenditure line here, and a slight, actually I guess in all cases that's slightly above the projected revenue. So we have a stepping down, but not in as dramatic of a way as some of the other accounts. And then finally, admin. So here in each year, we have expenditures above projected revenue. So using some of that previous balance for those expenditures. So that is kind of the overview. Maybe I'll just briefly, I know there's a number of accounts to kind of keep in mind, so I just want to do one even briefer pass through and then open it up for questions and comments. Yeah. So overall, we have this kind of pattern, and we see that come up in childcare and in education, especially, of decreasing in being, I should say, expenditures being considerably higher than revenue in this current fiscal year, and then dropping down to be closer to revenues for the next couple of years, and then dropping further in 23, 24. There are some exceptions to that. Mass media communications is a little bit of a flatter expenditure line. We do get that pattern in education as well as childcare. Also in R&D. And then the next two of unallocated is fairly even, and admin is a slight increase year over year in expenditures. So I'll pause that. I can also kind of stop the screen sharing if we want to be looking at each other and bring it back as needed. And open it up to see if any commissioners have questions or comments or reactions on those figures.
Chris, I think you had your hand raised. Yes?
Thank you, Camille. Thank you, Aaron. Can we go back to the childcare slide?
Yeah.
Just ask.
Right up.
Yeah, if you could describe it. This one has such a precipitous drop. I wondered if you could explain more about that.
So again, these are expenditures, and the drop you see, Chris, is impact ending. So it goes to 22, 23, and then goes down. So what our next investment in childcare would be, you would, as time goes on, I would think you would see that as the commission makes a decision about where we go with that, that black dot would go up as a future expenditure. Does that make sense?
It does. And the second question about the rollover or the fund balance, essentially impact is spending the entire reserve of the childcare account, theoretically, roughly. Is that fair?
That's fair.
Okay. And then can we go to R&D?
Mhm.
Before you, I want to come back and ask a question about that in a bit. So just
Okay.
come back to it, but not now.
This account, can you, I'm not looking at the way they're defined in statute, but does someone on the call have that section so we can understand what these dollars can be used for? I know it says R&D, but I also know that statute is a little more detailed. I'm also noticing the big drop, and I get it because we haven't planned that far ahead. We haven't made commitments that far into the future, but the fund balance is right. Thank you so much. Number 4. Children are ready to enter school. Research on the best practice. Okay. Okay.
Pretty broad.
Is that,
You know, I think it would be interesting. I know there's a subcommittee of the commission that works on these issues with your director. I wonder as we go into the future, we could think more broadly about what could be considered evaluation or assessment or research, maybe than we may have in the past, given the balance here. And then finally, admin. This I've mentioned before of concern that as your balances are dropping, theoretically you're monitoring fewer dollars in the community, and yet there's a flat, or even a ticking up slightly spending on admin. So I think your point at the beginning, Camille, about looking at creative ways to partner with sister agencies or philanthropy or, county offices of education, et cetera, I think is great because it will help with managing this. This is a small number of dollars. I mean, that's the other thing about these slides. The totals are very, very different, but they look similar. So, this is an area for further discussion, I think.
Thanks,
Thank
Chris.
you.
Yeah.
Thank you.
George, did you want to come back to the childcare?
Yeah, just for a second, the childcare. What's involved in the childcare expenses, and how many children do they impact? So we're talking about having our support program for care sites, I think, is there, and we have 1.2 million kids under the age of 3 in California. How many of the 1.23 million are affected by what we're spending in childcare? So which programs are we looking at, and how many total kids are in those I'm thinking in population health terms, where we figure out how many people are immunized and how many people are of the total population. So what's the total population, and then how many people in that total population are affected by these particular programs? Camille, do you remember what the scope is of each program in terms of kids served?
kids served?
Participating in.
Yeah, kids served.
So we have, George, 426,000 children currently participating in Impact in QCC. So, and that has grown significantly from where we started. It continues to grow. So, but that is our last count for the last year of
That's a
of
good
that.
number. 426,000, and the population of kids that might possibly served by that is what, 3 million?
I think, Aaron, are you?
Yeah, let me bring her in.
Yeah, let's bring Aaron back just to see. Or David, one of the two. Hold on here, we're getting them.
Yep.
They're both in.
Hi.
Aaron?
Yes, so we have about 3 million children 0 to 5 in California. So that's correct.
Right. And of that number right now, 426,000 are affected by impact. How do we feel about how big should that number be? An impact is impact. Is that optimal, or should it be twice that number or 3 times that number? If we were doing this really well, what would the right number be on that 426,000?
Yeah, well, I do think that we have a voluntary system for quality improvement in California. So there are no site types that are required to participate. In other states, like North Carolina would be an example, the quality improvement system is actually part of licensing. And so every site participates. And so in that way, they are reaching, you know,
if we use that standard, how big would that number be?
I think about 70% of our children are in care that is outside of parental care. So looking at family, friend, and neighbor. So 70% of 3 million.
2 million, roughly. It's 2 million, yeah.
Yeah, it's about 2 million kids. So we're probably reaching about a quarter of the kids that we potentially could. And there are a lot of factors that go into that. We currently have a rating system that was developed under a federal grant, and it hasn't undergone a substantial revision. Right. And it does cost a lot of money to rate sites. But I think that's part of what's coming out of the master plan. And presumably with a system that is more efficient and more streamlined, we could add a lot more sites in. And there are other considerations as well. Data systems are very expensive. So if we streamline that, then potentially you can bring more sites in.
Yeah, what I'm suggesting here is that if we think in terms of population health and public health agendas, then you always think about what's the population.
Sure.
You don't do a population health agenda. We immunize 70 people. Wow, we're great. It should have been 7 million, and maybe we're not great. Could have been 7,000. We're wonderful. And so we always have to know what's the relative number on each of the population and each measurement, each achievement. And so if we've got 426,000, if that was another state, that would be 1 million. Then that's opportunity for us. And then back on the last line that I read at the beginning of the meeting about use outcomes-based accountability for future expenditures. What's the outcomes-based accountability? It comes from dealing with only a third of the children that we should be getting to. Maybe it's a great use of that money to even get to a third, but we should be thinking for context, how many kids are we serving, and what percentage of that are we serving with this program? And it sounds like it might be about a third of, but we should always report that context on our discussions so that we know from a public health perspective, what is the universe?
Yeah, and I think that also, I see a couple of hands going up. We've got David, Molly, Shana. That there's also a connection point there to what came up earlier about what the format of future proposals to the commission is and what sort of information is included there. And so that may be an opportunity to lift up those sorts of information fields. David?
Yeah, I just wanted to say that, you know, in the annual report, we do, which includes data from the counties, the total number of children served last fiscal year, 18-19, was about 780,000. So now that's not just a first 5 California investment. However, first 5 California's investments do go to many of the county commissions through Impact, Small County Population Program, Talk, Read, Sing, etc. So, so it kind of depends on what effort we're talking about, whether it's Impact or as the Small County Program or Talk, Read, Sing or Kit for
And what would be the total population that we could reach with? I mean, Talk, Read, Sing, we know we're getting to 95% because we've got that measure. So with Talk, Read, Sing, we actually set goals and then we have been working against those goals. On Impact, have we set goals and what percentage of the total population we could serve are relevant to those goals? And are we happy with that? And should we be rethinking that use of money? But again, what are the relative numbers here? What you're saying is that we're reaching 780,000 of the 3 million?
Yeah, and I think it's probably worth noting that Impact wasn't necessarily designed as a universal strategy like some of our other strategies are. So I don't think that with the money that we have, we ever intended to serve 100% of the children. What we've really tried to hone in on are the children who are most in need. You know, looking at the populations that are most in need of higher quality care. Infant toddler care is consistently of low quality. And so we wanted to try to get to our babies, and our babies are in family childcare homes and they are with family, friend, and neighbor providers. And that's why with Impact 2020, we really tried to be more targeted. So I do think that you will see the number of children go up, but reaching higher quality standards also is expensive. And so you know, I think this wasn't intended to be universal, and certainly there are things that we could look at that would be more universal, but really targeted toward those kids that need those supports most.
Right. What I'm saying is, though, yes, as we take a population health perspective on this, what is the population, and for how many people are we affecting their health? And we need to sense proportionality, because 700,000 all by itself is a big number, but it might be a perfect number, it might be a really good number. If that 700,000 turns out to be the highest need kids, that's a magnificent number. But we haven't defined the highest need kids or the population as clearly as we could to make this, our sense of how are we spending that money clear. And until we do that, we really don't know. I mean, that could be a really good use of the money, or it could be we're not getting enough lift for that spend. So context is important. I've only got a short while left on the commission. I spent a lot of years doing public health. I worked on the immunization standards for the whole country, and we actually got them up from the worst in the industrialized world to one of the best by doing that kind of thing, by focusing on each condition, each immunization, each approach, each population. And we will be better off here if we do that as well, because otherwise the money just goes down a pipe and we don't know if it's optimal unless we measure the pipe. That makes sense?
Thanks.
Does that make sense?
Yeah.
I know there was a couple other comments here, maybe in relation to that. Molly, did you have a comment? It looks like you're muted there.
Molly, you're muted.
Okay.
There you go.
Yeah.
There you go.
I felt like Shane and I had the same reaction, and I think it's been cleared up by what George is saying. George is not, it turned out he was talking about impact and he was using universal numbers. but George is well aware that what you really do is you figure out what subset of kids you're trying to help, and often they are they are more expensive, and you're not going to reach as many of them as you want to, but you can't just keep working with the kids that are plentiful and easy. You have to work for the kids who need it most.
Yes.
And I think we're all in sync on that. We all understand that, but George's point remains right, which is once we define what we're trying to do and really figure out where those kids are and what we can do to help, then his idea of having targets and holding ourselves accountable feels very right to me.
Thanks, Molly. Shana, did you have an additional comment, or was that?
Yeah, I mean, yes, I think Molly and Aaron and Georgia, said exactly what I wanted to do, which is that we aren't trying to serve all 3 million children age 0 to 5. We are focused on serving this subset of high needs children and families, right? And so identifying exactly what Molly said, who they are. And I know, to Aaron's point, we are working in that direction. And so I think just having clarity on what those numbers are, where those families and kids exist, and how well we're doing that is really important. But it isn't about serving everybody. And do really want to underline Molly's point, which is it's about going deeper, doing better, but not bigger. It's not about serving more people. It's
Right.
about serving the right people better.
Optimal. It's the optimal people, right? We need to serve the right number of people for what we can do in order to target and what their needs are. And to do that, though, we need a sense of scope and context and numbers, and we need to measure that, and we need to say how many high need kids are there, and then we should hold ourselves accountable for helping them. And so we need to figure that out, and it's not just gross numbers helping lots of people, it's helping the right people in the right way with the most opportune tool. And if we do that, it's going to be a much better use of the money. And that's one of the things that one of the reasons we're having this meeting and this discussion and looking at these budgets is to think about that. What is the best, most opportune use of our money? And how do we get to the right people? And as Molly said several times, and how do we make sure that we're targeting, aware of, helping those really high need families?
Yeah. And we'll have, in just a few minutes, some time to look at current projects and think about some of that context and what they're setting out to do or achieve, and then also talk about what might be needed additionally. I wonder, just before we move into that, if there are other questions or comments that you'd like to share on the financial information and account charts. Molly, was that?
Just like to, while we are, I'm good. While we are talking this way about kind of raising up our game a little on data targeting, I'd just like to say that that is not a criticism of where we are now or what we're doing.
Right.
We are a group that's in process from programs that were conceived as more universal, more untargeted. I go back to a time when we actually had the Packard Foundation, a representative saying that programs for poor children are poor programs. And this was very sincere, very sincere. She was very concerned that any program that was targeted would be a poor program. And that's why she felt very committed to universal. It was a big, you all remember, it was quite the big fight. It was quite the big battle over that. But the organization is evolving, and we have an increasing consensus on helping the kids that need it most. And why should we be surprised that since we are sort of moving from one idea to another and one habit of being to another, that our systems for digging deep in the data and doing the targeting and being very attentional, may not be completely in sync yet. And this all happened at a time when the staff was shrinking and there were terrible budget problems.
Yes.
So Camille has been dealing with that too. So I think this is a very good conversation to have, and and we just have to put it in context for where we are as a group.
Absolutely.
And yeah.
I'm a fanatic about continuous improvement. I think we need to do continuous improvement in pretty much every part of our society and every organization. And the way you do that is you have a sense of where you are now, and you assume that you've got all kinds of legitimate reasons for being where you are now. And then you say, from where we are now, how do we get better?
Yeah.
And
It's
what do we
continuous.
do? Continuous improvement. Yeah. And continuous improvement is really great fun. It's hugely productive. It's very useful. And you'd never say, okay, you guys were wrong, or it's not judgmental. It's basically highly functional. But highly functional going forward is, at a functional level, we're now saying, guess what? There's an opportunity for some real high need families here. Why don't we figure out a way to identify who they are, and then to figure out what they need, and then to figure out ways of helping them? And to do that would be continuous improvement over what we did back in the time you were talking about when people were saying don't target. We're now saying we're improving to the point where we're saying target is really good. So the question is, how do we make that target, identify the target, and then achieve it? And when you do that, the other thing I can tell you about achieving targets is when you set a target in an area, then everybody gets smarter. Everybody gets more cooperative. Everybody gets more collaborative. Everybody comes to the table and lists all kinds of other ways of doing it, and they come up with ideas that you never would have thought of and add them to the pot, and the whole thing gets really, really better. I mean, we did continuous improvement at KP. We were number one. There were 80 measures of quality in the country. We were number 1 in 60 across 10 million people, because the doctors love doing continuous improvement. Once they got started down that path, they initially resisted. Once they got started down that path, absolutely loved it, became fanatics about it, got better and better at it, and then shared with each other. And then a best practice in San Diego turned into a best practice in Honolulu. That type of thing happens. First Five can do that in the county level. First Five can do that with other organizations. But if we get down a continuous improvement path, we will continuously improve and everybody will love it. But you have to go down that path, and it has to be intentional. And to your point a minute ago, and we can't criticize anybody. It cannot be saying, okay, you guys were wrong before. We have to say, okay, how do we get better?
So I think in talking about the now what, which is what you all are saying, totally appreciate that and your comments. I think, Aaron, you want to, I'm just a little worried about time is all. So how we move forward?
Yeah, thanks Molly and George for the framing, helpful, just thinking about improving, moving forward, and how we do that. Yeah, let's move into talking a little bit about current projects, and specifically the ones that some of you identified in advance as wanting to hear about and discuss, and kind of put these into two groupings. I'll see if I can make this a little bit bigger here. The first set being those that more than one commissioner indicated interest in talking about, hearing about, and then the second being those that were identified by one commissioner, but not more than one. So first set here, we have Talk Read Sing, public relations contract, and state and federal advocacy. So my understanding, Camille, just checking that we're going to hear some brief remarks from staff on these, and I'll put up the table from that document of project information, and then open it up, and as we go down the list of projects, for questions and comments that you all may have. So we can.
Right, Aaron, exactly right. I've asked staff to limit it to like 3 sentences, just to give you guys, just a highlight of and to bring focus around what we're talking about. So with that,
can you go back to that last slide for 1 second? And that bottom list of things, we should go to our mission, and we should add school readiness.
So, and George, we have, when we get a little later in the next session, I suppose, is focused on what additional should we do, whereas this list is of the current projects that exist.
Got it. Okay, yeah. We need school readiness on the list is something that we focus on. But yeah, maybe later in the discussion.
Great, thanks.
And Charlotte. Okay, so with that, folks and staff, we have you queued up. Sharna, we're queuing you in as well, but we're going to start with Jamie Ann Collins-Lopez, who's...
What is Sharna logged in as? Because she's not.
Sharna, can you let us know what you're logged in as? Just text us. But in the meantime, Jamie Ann, can you just give us really high level on where we are with the media campaign?
Hi, good morning. Can everyone hear me?
Yep.
Yes.
Okay, thank you. Good morning, commissioners. I'm going to give you a brief description of the public education and outreach media goals. Obviously, the overarching goal of the contract is to change behavior of parents and caregivers of children 0 to 5 in California. The main objectives of the contract include increasing parent and caregiver awareness and education on the healthy development of children 0 to 5, and utilizing emerging media strategies through broad-reaching mediums like television, radio, social media, and digital to deliver those messages, and identifying strategies to effectively target and reach California's diverse populations, as well as to brand First 5 California as a recognized and reliable source of information for children aged 0 to 5. To ensure that we meet these goals, we use a variety of existing research, targeted focus groups, and contracted third-party evaluations to guide and inform our efforts. The public education and outreach contract is in its last year of the current agreement. And we can move on for discussion. Let me know if you have any questions.
Thanks. So that's on the public relations contract. And so we've got that information up here that you all have had in this document of tables kind of describing the project and its purpose and some additional information, finances.
This is the Fraser media contract.
Okay, so we're up. I was right before.
Yeah.
So we're up here. Okay.
There you go.
So media campaign, media contract is what we're referring to here. Okay, thank you. Are there questions, comments on this project?
This process has gone really well. I mean, we actually did what I just said a little bit ago. We said we measured status, and only 10% of the Medicaid moms knew they could influence their child's intelligence level. We set a program in place to teach everybody talk, read, sing. Makes a difference, and we got that up to 90%. We're aware that you can talk, read, sing to your child and make a difference. And so we actually achieved that goal. I've shared that with several national child care programs, and they all tell me that 90% is impossible, that you didn't possibly achieve that. You should have somebody else go back and measure. It can't be done. So I send them the measures and they say, holy crap. Because in a public health campaign, if you move the needle 10%, you're magic. And we moved the needle 80%. And so that's a good thing. So that program has worked incredibly well. And one of the reasons it's moved incredibly well is we have insisted on the discipline of the goal, because advertising people love to change the topic. They love to do new ads, new fun stuff, new approaches. In an ad agency, you get people who always want to come up with a totally new way of thinking about something. And so they set different goals, different approaches. And we've had the discipline of staying with, no, we want 90% of the mothers to know that they can talk reaching to their children and the kids. And because of that, every one of the ads has focused on that goal, as opposed to just going off and doing fun stuff. I mean, Powder the Otter about clean water isn't on the agenda because clean water isn't a brain development goal. And so what we do is we do talk, read, sing, and we do the birds, and the birds could not be more. So this program has been really fun to watch. It's really well done, and the agency has done just excellent work in that space. In the Hillary Clinton Talk, Read, Sing, the Too Small to Fail campaign that they do in 30 cities is all anchored on the same Talk, Read, Sing message. And they have the same kinds of satisfaction with it that we do.
Thanks, George.
Chris has her
Rebecca,
hand raised.
Chris and Jackie.
Yeah, hi, thanks. A couple questions on this. If it's expiring soon, how many months in advance of the expiration do you need to put a new RFP out? So are we headed into any sort of a gap?
We intend not to.
So what's the timing?
So we'll be coming to the commission next month for the ask for the new 3-year contract. We intend to put out the RFP before the end of the year. The new contract would take effect next June. So we're giving ourselves about hopefully 7 months to advertise and go through the process.
So it's open to everyone. It's not a contract extension.
Right.
And then the scope of work you'll describe in the RFP will be developed by whom? And does it come to the commission for full discussion and approval?
So the scope of work will be developed by First Five staff. I should say we're also incorporating the public relations into our new media contract. We found that it's more cost effective to be able to share collateral and ideas with one overarching media group. But yes, so we have and we will continue to take recommendations and suggestions and focus from the commissioners to develop. I think that, and I don't know if Camille, you want to step in about whether or not we can discuss specific tasks on the RFP publicly with the commission and what situation that puts in.
Right. If you'll recall, at one of our last public education and outreach committee meetings, we talked a little bit about what the committee would like to see in the framework. Because the committee because those conversations are a public meeting and this RFP can't be shared without it going public, and to do that kind of is not the way to share an RFP before you put it out. So trying to get Chris as much information around a framework and what kinds of activities people would like to see without sharing an actual RFP is the goal. Does that make sense?
Yes, it does. It does. And yet, I mean, if you were to lean in completely to public input to help you develop that scope, you could invite different stakeholder groups to provide you with advice on how best to use those dollars in upcoming communications work, rather than maybe going the other direction, which is, oh, we're so concerned this is a competitive process, we can't undermine that. You know, that's a very strict legal process. But if you're in a development stage and you're accepting input, I think that would be a really nice way of counteracting that you do have to keep it confidential at some point. And as you know, Melissa said in her introductory remarks, and I think we're all saying, at this particular point in time, I'd love to see us moving more and more and more toward highly targeted, very specific outreach to populations that have been very underserved and would benefit greatly from, bigger, deeper investments in their well-being. So and I know with Fraser, there are subcontracts with minority-owned communications firms, and there have been attempts to do this, and I know there have been some evaluations, but I think it's a wonderful opportunity to figure out how to create maybe more of a collaborative approach to communicating across the state in ways that are very, very specific to certain communities and their needs.
Thanks, Chris. Jackie?
Thanks. I was going to talk on a similar line as Chris. I love Talk, Read, Sing. I think we've done an amazing job. I, however, have not seen those results of 90%, and would just want more information on that before I can really speak to it, because my question would be, is that 90% of California parents? Is that 90% of a population surveyed? One of my responses in my early days as a commissioner to Fraser and to the commission was really reaching into our hard to reach population. And I argued the point that I don't know, with access to radio or time to listen to the TV, that I think that 90% is realistic. And I think we have to, and I'd like to see it, because I don't want to speak to something I haven't seen or that I don't know. It's just those statistics are often said, but I just don't know what they are. As a result of that, Fraser came out and Crystal Stairs picked some populations for them to work within to get a sense of that. And again, while there was familiarity with the, not even the tagline, but there was familiarity with the bird and the song. My question is, how much are we penetrating and affecting change for these hard to reach communities? And so this isn't as much as the RFP where I'm concerned, although maybe, because I would think that in that scope of work, we would build in some accountability. It sounds like this commission is, I won't say shifting from what it has done before, but really narrowing in on something that is important. And for that, I think we have to really challenge ourselves to find real information, really deep information that is coming from those targeted populations. I'll say this again, all California children are important, but the reality is, when I was having kids, I didn't need Talk, Read, Sing the way some of my counterparts in lower income communities needed it. And that's what I feel like we're kind of putting our pitch in the sand, that's the work that we're doing. So I think we have to hold ourselves accountable to that.
David?
Yep, good idea.
Just brief comment. So Commissioner Majors, the data that Chair Halverson is referring to is the California Health Interview Survey data, which is a statewide population survey. And so the recent data from that shows that 87% of parents did recognize the message of Talk, Read, Sing. And the UCLA researchers used that data to write a brief, which I'm happy to send to you. And what they did find is there were some gaps. So the two groups that were reading less of their children were Spanish-speaking families and recent immigrants. So on the one hand, the research brief showed that the general message is well known, but there are some gaps.
And just a question, David, thank you for that information. I appreciate it. And I would like to see that information. It's not something I believe has been provided in the past. My question also will be the sample size, the sample communities. Where did that data come from?
So as I mentioned, so the California Health Interview Survey is a statewide population survey. It's conducted in multiple languages. it's considered to be a very high quality scientific survey. So in the brief that I can send to you, it will provide some of that background, but it is a very well respected survey. And that's one of the reasons why First Five California has been a long-term funder of that survey.
Yeah. And I really, if you could just hold on just a minute, I really appreciate that. And I respect all those levels of research and evaluation. And so I agree that it's respected. And I will say this, as an agency that's on the ground trying to do census and trying to get at families in these hard to reach communities, if we can't do it, and we're on the ground, I would just argue that there are people we are not touching. This is not to show a lack of respect for that research, for any of the collegial organizations and institutes that are a part of it, but I am on the ground trying to do census. And if you look at the census numbers for LA County and many areas in California, you will see that the hard to reach populations aren't responding. And so I would just, to liken it to a survey. Whether we do that through, and a lot of those surveys are done through social services, like my agency, or through medical offices. I also do health outreach in my organization, still trying to get folks from those communities to get, health insurance and get connected. There are hard to reach populations that I even think the best researchers are not tapping into, and I challenge us to try.
Thanks, Jackie.
Sure, that's definitely so I think we could have a whole conversation just on that. I would just say that actually UCLA is, because of the issue of reaching hard to reach populations, they've been testing what's called multimode data collection. So they're using mail, internet, and phone. And they're actually a leader in trying to do that amongst states. So I'll send you the brief. I'm happy to send that. And if you have additional questions, I'm happy to discuss with you and or even put you in touch with the UCLA researchers too.
Great, thanks, David. And so Shana, your hand go up, and then if we can maybe move to our next project after Shana, your comment, please go ahead.
Yeah, no, I just wanted to add, piggybacking a little on Jackie's point, and David, I'm wondering if you can share. So for me, yes, it's important to know that people recognize the message, but I know in the past we had talked about behavior change as a result. And I think that was something that George had mentioned in the past. So do we have data on that? And if we do, if you can share that. And I think just generally, that's what we need to be working towards. And I think even more generally, and I know that's not work for today, but really thinking about, and I put this in my response to the survey before this, the outcomes, right, tied to these investments, and then being able to set some reasonable goals, have a dashboard, and then be able to see how we're tracking against those things. So just want to flag that, not for today, but for a later date.
Right, and as part of that, one of the follow-up questions, how many of the mothers, we got up to roughly 90%, heard the message, knew the message, only half are reading. And the reason only half are reading is because only half of them have books. So we did exactly what you just said. We followed up, what's the impact? And the number of readers is way up from where it was before because it was lower, but still only half. And only half because they don't have books. These low-income homes just are deprived. The equity issues on that, I keep talking about, are massive. How in the hell can we have white families with 12 to 20 books and the Hispanic families and the African-American families with over half the homes without a single book, and not just be really ashamed of ourselves as a people for not doing better in that space? But we did measure that. And so the good news was the campaign did, I mean, you can argue whether or not that's a perfect number, but nobody else in the country has ever moved the needle more than 20 points. And nobody has definitely moved it by 80 points. Our 80-point move is huge. But even if we only moved to 20 points, we'd still need equity on the toolkit that those families have in their COVID confined homes. Anyway.
So it sounds like there's some follow-up. Myra?
Thank you. And I'm sorry that I had to step out and I'm back. And thank you to Jackie and Shana for catching me up because I was able to get what the competition was about from your comments. I just want to respond, George, to your comment. I want to say I fully appreciate the need for books in homes, but I want to acknowledge that this is a time of extreme difficulty for families across California, and in particular for Black and Brown communities.
Yes.
And the inequities that exist go far beyond books. And one thing that our own campaign says is talk, read, sing. And when you look at these communities from an asset-based approach, not a deficit-based approach, you find that there is greater connection, family cohesion, there is talking, singing, dancing, music that is also incredibly enriching for young people's experiences and healthy development that isn't often acknowledged or even considered as valuable, particularly in some of the comments that we share here. So I want to just call that out, and especially to the public that's hearing us, how important it is that they know that that is valued and considered a positive contribution of these communities. And it speaks more to how do we measure that impact so that there are other components of this campaign of First Five efforts that are supporting, vulnerable communities and their healthy development and their commitment to healthy development of the kids. I don't want to at all dismiss the value of books, but I just want to recognize that it is a both and approach here, and the and components is particularly more important during this difficult time.
Yeah, I'm totally, completely. The and component is massive. But I read over and over again about the earning inequities, the family wealth inequities, the racism, the prejudice that has caused all of those things to happen. At KP, we actually put the race of 10 million patients into the database, and we tracked care outcomes by clinic, by race, by ethnicity, and identified differences that we didn't expect to have happen. And then we made changes in care delivery when we found that Hispanic males were far more likely to have prostate cancer. That wasn't racial, that was cultural. So we went back and figured out what that was. So I've been on this path for a long time, but the Berkeley study that they quote so often studied 8,000 births, and what it did with those births was it checked the differences on the learning readiness levels of kids who were from every level of Hispanic family, single, double language, current immigrants, second generation immigrants. I mean, they broke it down by income level, they broke it down by recent immigration level, they broke it down by every single measure, and they said those homes were wonderful, as you just said, on loving the kids, hugging the kids, having great relationship with the kids. The kids in those homes were not being abused, and they also said that the average child in that group was 6 months behind at age 4 and stayed behind for life. The average child in that entire group of California Hispanic births was 6 months behind by age 4, stayed behind for life. And the only families that didn't stay behind for life were the Hispanic families from that group who had books in the home. Those families, they all loved the kids. They were all reading with the kids. They were all doing good stuff with the kids. And the book as a tool was very, very, very useful in those homes. And so, yeah, I totally agree with you. Yeah.
Yeah.
Going.
Yeah, I think we'll get into the both and of this later on. I know there's some other ideas around what additional investments are needed, but would like to see if we can at least get through that first set of projects at the top here that some of you have expressed interest in discussing today. So the next one up, which I know there's some reference to in relation to the media contract, is this public relations contract.
So Oscar, do you want to just give those three, very succinct description of what's going on with the public relations contract? Again, understanding, commissioners, that we will be putting the public relations contract into the media contract the next time it goes out.
Thanks, Camille. I appreciate that. Commissioners, this public relations policy contract we hired Golan Harris International, and they were basically hired to help us build our public relations capacity and help us increase our media campaigns, our existing strengths and infrastructures with the state association, local commissions, and other stakeholders. And this contract provides strategic assistance on best methodologies and content on how to best reach out to California's large, ethnically and culturally diverse population, as well as, and more importantly, our policymakers, to help us increase our awareness of brain science, building our brand, and influencing the policymakers by sharing content, data, and very relevant data to help us develop all of our tools internally and externally to get us the best coverage and get us the right coverage to those people who are the ones who make decisions and who could best utilize these particular services that First 5 California provides.
Thank you, Oscar.
Questions or comments, commissioners, on this public relations contract that moving forward is going to be incorporated into the media RFP?
I have a question.
Go ahead, Myra.
Thanks for the overview. Is there an opportunity to discuss like what issues we actually promote? So I recognize that the campaign is doing a lot around census and young children, which is incredible. At what point is there opportunity to include other topics to ensure that we're responding to the crises around us, for example? Is that an ongoing conversation, or is the contract delineate that from the very beginning? And if there is opportunity to re-examine what that's going to look like moving forward, I would strongly encourage us to consider the drop in vaccination rates and, well, child visits, 40% drop in vaccinations in California, given the first 5 years of life are so important. So are those screenings, those developmental screenings, and so many of them are happening virtually or through specific practices and clinics, but wanted to encourage that through our public relations efforts.
Very good point, and absolutely, there will be opportunities on the upcoming PFL when we're incorporating this particular contract with the other contract that was talked about by Jamie Colin Lopez, my colleague, and they're going to be melded together, and this will be one component on it. However, this one already has defined work products, although there is opportunities to include some new and relevant items. The big ones have already been established, and those include topics such as paid family leave, the First 5 California rebranding, which you will be hearing about next month, and then the rebranding of the network as a whole too. After we're done with the First 5 California rebrand, there's opportunities to and execution of early childhood education, information, media, and things of that nature. And where all of this is important is we've also tried to pivot and incorporate all COVID messaging on everything that we have where it's appropriate. We also have work streams involving home visiting, daily news clips, training and capacity building, which we'll be hosting next month, or I'm sorry, I believe it's at the end of this month, with all the First 5s and their staffs on how to even do simple things that can help the local commissions, even in this weird time where everybody is doing things on a Zoom and GoToMeeting and FaceTime level, where all the interactions seem to be virtual, on how to record and reach out and do things even on your phone. And we've had a great response, and we're really looking forward to doing that. So it is multifaceted, but there will be opportunity once this is developed as an RFP with the other particular contract.
And appreciate the, am I muted? Yeah. Appreciate, Myra, your question. And as we look to not only the future, but burning issues now, please feel free to reach out to us if those aren't getting addressed, so that we can work with Golan now to see how we can do that. So there are opportunities there. So appreciate that.
Also, Myra, at the next commission meeting, there will be an action item to develop the framework for the next contract, which will align both the public relations and media so that we can share campaigns and are looking for your input and direction about how to expand that as well. So absolutely.
Great. Chris, I see your hand up. Oh, sorry, Myra, did you have a response?
So I just want to clarify, and maybe it's a simple yes, no answer. There is no dedicated state education campaign on child wellness right now. So 40% drop in vaccinations, kids aren't getting their well child visits. You know, there's less likely going to be getting physical screenings because there's no in-person back to school. So there is sort of an urgency, but isn't there an opportunity to integrate some of that important messaging into our campaigns now?
Yes.
Yes.
There
Great.
is, Myra,
Absolutely.
this is Jamie. We do currently on the Fraser contract have a PR component where we allocate funds for those types of things. That we've done that for census, we've done that for Talk Read Sing and enhancing that. So yeah, there's room to work on those projects as well currently on our current media contract.
Awesome, thank you. And to the extent that I can be helpful with any of that, you have Sharna and you have a lot of other folks, but I'm looking forward to that. Thank you.
We're looking to you.
So far.
All right, thanks. Chris, over to you.
Yeah, I want to just underscore everything Myra said about thinking more broadly about our communications work beyond what it is First Five California or First Five's fund, but more broadly what children need and where those resources may be that live outside of First Five, directing people to those. I think that's the examples of census. Those are great examples. I think we need to continue to be essentially an aggregator of information that benefits young children and their families, and the communicator about those resources, because there is no other place in California where resources are devoted purely to public education like this. And so it is critical that we're really broad in our approach around content. And then my second point, which may be more related to the media contract, but since you're combining these two going forward, I think we absolutely have to make it a requirement of folks that are going to be competing that they show extensive experience working in communities that we're trying to reach. They're firms. It has to be either a number of years that the individuals who are being named as principals have themselves demonstrated through other campaigns that they've been very, very successful. We have to get the people, you know, that we can't leave it to chance that they're going to be on a team. We have to ensure that that's who we're hiring, because the expertise is, it takes years, decades to develop the kind of expertise we need to get our message out there.
Thanks, Chris. Jackie, see your hand up?
Yeah, I just wanted to say to Chris's point, as we're looking for that, and I want to make sure my point was clear, because I don't, you know, I'm not challenging research. I'm challenging us as a commission, and I'm challenging us as a country when there's systemic racism and implicit bias built into people as good as the researchers, that we have to challenge ourselves to use other ways. Myra just dropped statistics on us and information that most of us didn't know, which gives us an opportunity to think about how we direct our resources. So I would also say, in what Chris suggested around the partners that we would be looking for, is also that they have a diverse reflection of employees, that they are. Yeah, maybe that they contract with, but it sure would be nice if these people were part of their organization and part of their family, so that they weren't just hiring a diverse population or working with a diverse population for our work, but that it was really embedded in who they are, so that we can get a sense of their ability to understand from a broader perspective, and not just I'll leave it at that, just from a broader, more intuitive perspective, by having a rich, diverse staff.
Thanks, Jackie. So I'm going to move us into the next item here. Not seeing any hands raised, which is state and federal advocacy. Let's pop this up for a moment, but I'm gonna scroll down to the table. There's a little bit of a longer description of this. You can find in this project information document, but I'll keep this these tables up on the screen.
I think Alex is ready to go. Alex, are you there? There you are.
Good morning, commissioners. Can you hear me okay? Great. Well, as you'll recall from part 1 of our budget retreat, I provided an overview of our state and federal advocacy work. I won't go into too much detail today, but happy to answer any questions you have. So First Life California advocates for children and family-centered policies in the areas of child health, child development, and family functioning. First Life California's state and federal advocacy work and the contracts that support it are divided into 3 categories. 1, lobbying and policymaker education capacity, where First Life California's more traditional state and federal legislative, administrative, and budgetary advocacy lives. 2, strategic coalitions and partnerships, where we fund other partners and coalitions to advance the work of a particular area of our policy agenda. And 3, policy development, which allows us to serve the important role of convener, bringing together partners and stakeholders to develop recommendations around a particular policy goal. So a description of each of the contracts that live under the advocacy umbrella can be found in the project summary table in the materials. So a little bit, a few pages up from where we are now. But as we navigate what our advocacy efforts look like in this new COVID-19 reality, we'll start to see more of our work shift to administrative advocacy, finding opportunities to align with and amplify the state administration's priorities, both in California and DC. With that, I'll open it up.
Thanks, Alex.
Questions or comments on this? There's a bit of a longer description up above, as Alex noted, on this state and federal advocacy project.
It's extremely important work. We need to do it. We need to do it well. We need to have a positive impact. And most of the people we're dealing with in those various regulatory and legislative settings and congressional settings do not understand the importance of the first years of life to each child. And so we've got to get that into their brain set. When at the California legislature, we had on parental leave, we had huge positive flip over in support of parental leave when we said those first 3 months are when the brains change epigenetically, and you need parents to be home with the kids in that time frame. It's about the kids. It's not about the parent. This isn't a vacation. This is a chance for the brain to develop and the emotional epigenetic wiring to be done in each child. And we had people flip and say, okay, I'm on board. And we need to teach that science to everybody, and nobody but us is teaching it. So we need to get it out there.
Anyone else? Okay.
Myra?
Yes. So I'm just curious. A lot of folks are doing scenario planning, right? Given the uncertainty at the federal level of the 2020 election, particularly with regard to priorities for particularly vulnerable communities. It's, a 180 if we have a new administration. So can I say that? Okay, I said it. I said it. So I'm curious, is particularly in the work of our federal advocacy and our commitment to that and what it looks like. are we doing any sort of scenario planning with regard to a continuing Trump administration or a Biden administration?
Absolutely, of course, with a lot of anticipation and trepidation on any transition. But we are really looking at expanding our federal space or federal engagement even more than we have. In the past, we've shared with a lobbying contract with the First Five LA group, and we are going to be releasing the RFP to be a broader engagement so that we can support more and amplify the administration's priorities, knowing that regardless of transition, first of all, the federal funding is needed to sustain and grow our system, especially in response and recovery. But also to represent and organize California advocates and be the bench, not just for the First Five Network, but to get our policies into the transition teams and be defensive or reactive, whatever we need to do. We are thinking that through right now, and it is a challenge that I would love to share with you.
Thanks, Sharon.
Chris, see your hand up.
Yep, you answered my question, Sharon. I wanted to make sure you were developing transition plans since that's only what, 3 months away. And would really like to hear that described in our August meeting. Would really like to be brought in more and more to these discussions as a full commission. We know, just looking at how Congress is not addressing our childcare problem as a country, combined with existing dollars that come into the state and wanting those to become increasingly flexible, and potentially a transition both in the administration and Congress. I think it's a really, really, really good time to be doubling down on federal advocacy and joining with other states as to the greatest extent possible. So I'm glad this is still a priority. I encourage more and more discussion as our revenues decline, and we have to be in bigger and bigger collaborations across multiple issues to win. And so I just really encourage this is a growth area for the commission, and an area I think many of us are passionate about and would like to be involved in personally, where you're sending letters or hosting webinars, or maybe someday even making a trip back to whatever the options are. I think we're all pretty passionate about this, and see that the federal budget as one of the largest sources of revenue for our state when it comes to caring for low-income children.
Thanks, Chris.
Aaron,
yeah.
I know you have a plan now. I'm just wondering, at the moment, we don't have any hands raised for public comment.
Mm-hmm.
Chris, do you have your hand raised again? No, she says no. Sorry, we got the last one. So I just wanted to maybe say now would be a time for public comment on what we've had so far. Again, no hands raised, but just maybe do we want to give just an opportunity for that before we break?
Before we break, or
So what I propose is that we take a break as we have in the agenda, following any public comment. And then if you're one of the, if you identified one of these projects or have a specific question on another project, that you could review the information about that project over the break, and then we could have about 10 minutes when we come back for just any specific questions on other projects before we move into talking about areas for potential additional or new work. And our kind of starter list, just to kind of whet appetites here, is around, that have been suggested through survey responses, are around direct services, both in the early learning and care space, as well as more broadly talking about family self-sufficiency, books and literacy, as we've heard some discussion already about, and additionally, some one-time system investments, such as around a data system or some professional development initiatives for the early learning and care workforce. So that's what we have kind of on the slate for when we come back from a break. Again, following a little bit of time, if there are any specific questions that commissioners have on these items that we weren't able to get to a full discussion about, or other projects.
With that, Aaron, we don't have anybody. I think we silenced everybody else on the call because nobody has raised their hand to make a public comment at this point.
Okay, so I will officially then recess the group for how long?
I think if we could, I would suggest if we come back at 12:30, that would keep us on track.
That's half an hour. That's almost half an hour. 20 minutes. Do we need a 20-minute break? Okay. I'm not hearing anyone object. Let's recess until 12:30.
Right. Thanks, everyone.
That was lovely.
That's enough time to make lunch.
Yeah, there you go. Good deal.
But not enough time to eat it.
That's why I'm not yet on video.
Me too. Yeah. So, Aaron, you want to, we're still waiting for Monica and Chris, maybe?
Okay.
I'm here. I just also have made my lunch, but haven't finished eating it.
Okay. Well, we're just going to then get started and figure people are still having lunch, which is a good thing.
Great. Thanks, Camille. So as we just kind of wrap up this discussion on existing programs, as I mentioned just before we went on break, just want to see if there are specific questions on other projects that we didn't get a chance to discuss before or in the earlier session that anyone would like to raise before we move into discussing ideas for additional or new work moving forward.
From the list?
Okay.
Aaron, can we put up the list just one more time?
Sure, happy to.
Thank you. Any of those? Everybody's okay? Is Chris on yet? She's okay.
I guess I just had a question around Educare. Is that essentially all wrapped up, and are there any plans to continue, or is that something that's completely going away?
That is, as of this moment, completely going away. It was meant to help both Northern and Southern California get started. It was startup funding for the Educares, and now that they're both up and running, that it accomplished what we set out to do, and at this point we don't have any plans for the future.
Okay. I'm just wondering if there are opportunities just for ongoing learning, right? It was a meaningful investment, and how can we continue, sort of leverage that to continue learning from that model and figuring out, if appropriate, how it can be replicated in other settings.
I believe both Northern and Southern California would be very interested in sharing their learning with us without a contract, a formal contract, but and would be always up for conversations regarding how do we, what can we replicate? How can we do that?
That would be great. Because I just remember being very impressed by the model when it was first presented to us, and I recognize it's a very expensive model. But I think for us to think about which pieces are scalable and replicable, and particularly through this lens of serving the most underserved low-income high need kids across California.
And I don't know, Chris, you may want to talk to it, but when Chris was here, they did signature programs, and those really took some of the pieces of the Educare model and expanded and what we learned from those as well. And, you know, maybe going back to those lessons.
Yeah. Thank you, Camille. And Molly was too.
Oh, that's right. That's right. Oh, sorry.
That was not long ago, 9 or 10 lives, I think. It was, at the time that we invested, it was really an exciting opportunity to do a deep dive into quality and how that can be achieved in a really you know, very specific way in these locations. And looking into the future, I think what Shane is saying, you know, I guess I'd like to keep thinking about how they're evolving as a network and what are the opportunities for First Life California within that network, because there's so many partnerships within that group, philanthropic partnerships, experts, researchers, doers, lawmakers. I just wonder if it's worth, and not to mention the staff at each of them, the leaders at each of them, the communities that are supporting them. I mean, they're really two critical communities in our state. So I think even if we can't fund them,
right,
maintaining a relationship with them as, you know, one of the founding funders, or, you know, something like alumna of the Educare world, because it's just such an important national network that we deserve a seat at that table for all the investment that's happened. So
absolutely. Yeah, and I think that's what I was, you know, getting at, that I didn't want it to completely fall off our radar now that we're no longer a funder. And there's just so much, like, as we talk about, you know, just on this call, about sort of like more holistic services and really responding to the more comprehensive needs of vulnerable children and families, I think they're doing a lot right that we should be paying attention to and learning from.
Myra, do you have a comment, question?
I just had, yes, thank you. I just had a quick question about the advocacy data communication tools. Based on the write-up, it's my understanding it's a contract with the California Budget and Policy Center. I just didn't know what it was, and if there was an opportunity to do some sort of a briefing for folks like me that either maybe knew or maybe forgot. Can I just get a little bit of a background on what that does and the tools that we use and how we use them?
Alex, do you want to talk to that?
I think that was Oscar's. I don't know if he's still on.
And Myra, a briefing or an update or shared, we can definitely share documents as well. I don't know if Oscar's still on. Looks like maybe not. First Life California is a contract with the Budget Center to do analysis or briefings on a number of issues. Right now they're working on a project for us on home visiting, but they also support ECE asks. I have a couple primers that I can send you, but oh, there's Oscar.
There I am. Yes, hi. We wanted to talk about the California Budget Policy Center. Is that what we were looking at?
Yep.
Yeah.
Excuse me. Let me get to my notes on that. The California Budget and Policy Center, what they're doing for us is they're helping us achieve our children's policy agenda and our legislative goals by compiling. I'm sorry?
I think somebody just had a little echo, so you're good to.
Okay, I'm sorry. They help us create and compile data, analyses, reports. They provide communications on our behalf to legislators, stakeholders, the administration, the governor's office, anybody who is a willing partner and understands the need for good and relevant data that helps First Life California deliver our messages and share real information so that the lawmakers, the policymakers, the administration, and all these other folks can make informed decisions. And that's mainly what California Budget and Policy Center is doing for us. we're funding a lot of this very specific data, fact sheets. Again, they provide presentations to various folks, even though now we pretty much have gone to virtual. That is the long and the short of what they do for us. They create stuff that we need created so we can inform persons to do it. And this also goes hand in hand with the Golan contract, because we use a lot of what the data center puts out to inform reporters and give them good information so that it'll make their story more complete, more relevant, and have up-to-date data when they reach out and put things out there on our behalf.
And they have a deliverable in their scope to do 3 to 4 presentations, including potentially to First 5 California or the association. So if there's interest,
They have a lot more obligations than that, depending on what the topic is.
Shana, do you have a comment on this?
Yeah, I just wanted to highlight for Myra and for others, if you get a sense of really what we're talking about, if you go to their website and go under resources, there's just one example. There's a new publication, Subsidized Childcare Providers and Children Can't Afford a Pay Cut, that was supported by our funding, but it's a really sort of detailed, thoughtful report with meaningful data and analysis. But that's just one example, I think, of the type of work they're doing with our funding, but that'll give you maybe a good sense.
I think what Shana was also trying to say was, if the commission is interested, certainly we could ask them to present at a meeting to kind of give you an overview of not only what the work is that we fund, but their work in general. Would that be of interest?
Yeah, let's do that. That'd be good.
Yeah, and just so you're everyone's clear, I think the California Budget Center does incredible work and analyses, particularly on the economic side. And to Shana's point on the resources, they do a lot of work on economics and health and COVID and work and income and poverty. And to the extent that they can slice that from a child perspective and be able to tell the story of how the same issues that we're talking about for California as a whole impact young children in particular, that analysis would also be very helpful. So childcare, as well as all these other issues that we know families are struggling with in this time. So great.
Right. Seeing other hands up at the moment. So, Molly?
Yeah, there it is. I just wanted to say a word about Educare, to build on that. One of the things that was impressive and remains impressive about Educare is the focus on very at-risk kids. To be eligible for an Educare center, you have to be eligible for early Head Start, and that's a very that's a low. It's not the same as preschool or any of our means tested normal programs. It's a very targeted program. So that resonates with what we're talking about during this meeting and have for quite a few meetings. And the other thing that there's 2 other things that come out of Educare that sort of certainly have made it dear to my heart, but also make it resonant with what we've been talking about. One of them is something that you notice if you go to see Educare centers. Let's go to the first one in Chicago, then let's go to the one here and the one there and the one and the next one, and then let's go to the newest one. If you make a chronological trip to Educare centers, and I've done that probably more than once, what you see is that the amount of space in the center that is devoted to parents grows every time they do a new one, because they have found that that working with the parents is really important, and also to the point that it's expensive. They find that they can do Mother's Club parent group things for parents who don't have kids in the center, but who are in the neighborhood. And I've always thought that was interesting and important about their work. And then finally, another thing that they do, and this is all experimentation. These things have developed organically out of experience working with these children and their families. And what they do a lot of is they do book fairs. They literally get people to come, the parents to come, and they showcase books and they talk about the books and they have people read books and they talk about how important it is at home to support the early literacy by reading. So lots of overlap is the theme.
Sounds
Yeah,
really good.
So I'm gonna move us, and that might be a good segue here into really talking about additional projects or new work. And I know there's been a number of ideas in this area surfaced already last month in today's conversation in the survey. So just put a kind of a starter list here that is not, I make this a little bit bigger, is not intended to be a list that we're limited to, but more one that is inclusive of ideas that have kind of surfaced so far. So we've got, again, direct services, as you can see, a couple different varieties, books and literacy, and this idea around one-time system investments. And I think we've got about an hour here, maybe a little bit longer, to talk about within these areas or others, what are the types of projects that you all would like to see explored and information brought forth from the staff around at future commission meetings for consideration by the commission and further discussion by the commission. So it's kind of open space for wherever you all would like to start that. I think we've got various ground to cover. Shana, you want to kick us off?
Yes, well, so it's sort of something that I wanted to share before we went to break and maybe helpful in this context. So I was sort of stuck on, I was processing some of what George had shared about learning readiness and feeling like we may have been, or maybe I want to suggest that we don't conflate learning readiness solely with sort of rates of literacy or numeracy in 5-year-olds, 5 and 6-year-olds, right? And that thinking about social, emotional health, economic health and well-being is really critical. And those are all components of learning readiness. And so I was just feeling a little bit sort of stuck on learning readiness being narrowly limited to academics when we know that it's so much more than that. And so I don't have a specific recommendation about a specific investment, but do want to just echo that learning readiness is important. Learning readiness isn't just literacy and numeracy. And ties in a little bit to what we were just talking about with EduCare, right? So they are looking at the whole child, the whole family. Are there lessons learned there about where we could be investing, thinking about sort of deeper, more robust investments in children and families who really need us. So not a specific recommendation, but just sort of a larger frame for us to think about.
I totally agree with you. I am a bit puzzled by anybody thinking that I'm talking about readiness being just about books. I mean, I wrote the book 3 Key Years about emotional development, interactions, epidemiological. I mean, I'm talking about all of the full scope of supports that families need, kids need, and we need to make sure that the learning readiness is part of the agenda. But what we do need to make sure is that it's part of the agenda, and we have failed entirely. We keep getting distracted down other paths. And so our learning readiness failure is massive. Our learning gaps in all of our schools just got worse again this year, in spite of the fact First Five has been around this whole time. So we need to make learning readiness an anchor, and that's why we were formed, was to have kids be learning ready. And so we need the full scope of all of the things to make kids learning ready. That includes the holding and the hugging. And when you look at the books, there are a couple studies have shown that families who read to the books, the violence level goes down in those families. One of the reasons that they're passing them out in Tampa, Florida, is because they had the most violent parents in the country in Tampa, and they're passing out books to those mothers. And they found that when the mothers read the books, they feel better about their motherhood They actually, mothers flip over from being aggressive to being protective of the kids because books are there as a tool. But the books aren't doing it magically, the books are doing it functionally. And they're doing it functionally because the mother is reading to that kid, interacting with that kid in a loving way as a result of the reading process, and they feel better about the kid, better about themselves, and the violence level goes down. So it's a total package, but it's not, I have no sense at all that books by themselves are magic. But I also know that in the Hispanic families in California, the ones that did not have books had 30% learning ready, and the ones that did have books had 60% learning ready, and they all loved their kids. And yet we're trying to keep books out of those homes. And I don't know why. It blows my mind that there's such fierce resistance to getting books to low-income kids. And it's like it's a trick of some kind. Why is there such resistance to helping low-income families with books? You know, why would that be true?
Can this is
Monica, go
Monica
ahead,
here.
and
Yeah,
Jackie and Chris.
I kind of want to expand a little bit on what Cheney was saying, and I kind of want to name it more specifically in terms of conflating literacy with social emotional, and I really kind of want to name it more systemically as systemic and institutionalized racism, and really making sure we have an anti-racist agenda. And again, I am 1000% in favor of books, but I do think we need to deconstruct a little bit of what learning readiness means, and really look at how we can systemically change some of the deficit models that we have, and you know, I think as Myra was saying earlier, really look at more of an asset based. And so I think there's a lot of social construction around what learning readiness means. And so the data is skewed because of that. But just to reemphasize what Sheena said about social emotional, but really looking at sort of institutionalized oppression as something foundational that affects in almost everything we do. You know, we talked about earlier in the day when we started out looking at comorbidity and talking about COVID-19. Well, racism is the primary comorbidity factor in health and safety for folks of color in California. And so I think that needs to just be woven into all of our programming and what we do. So,
and on that point, and I agree, I've actually looked on the COVID thing at the racism and what aspect of racism is creating comorbidity. And I've looked at a couple of studies that have drilled into each of the comorbidities. And what they have shown is that being obese, being diabetic, being hypertensive, and having heart disease doubles and triples the death rate for that population. And I also know that if kids are not learning ready at age 3, they are 2 and 3 times more likely to be diabetic. So I go back and I make the racism thing ties the fact that we are not willing to help kids before age 3. It blows my mind because that is exactly the point in the process when you have to intervene. Kaiser, one of the things we did was we took 10 million patients and we put in electronic medical records, so it's completely electronic. And then we put in racial information about all the people. So we had 80 categories of race. We had subsets that we zeroed down. And then we went back and we looked at care at every care site based on what the racial patterns were. And we identified that there were a whole series of things. And we thought, okay, same doctor, same care site, same benefit package, same everything, that it's going to be the same. And we found the same thing we found when we did the ACEs study. And that was there were racial differences. Then we put together care teams on each racial difference. We put together people from each group. We put together experts. We put in scientists. And we identified how to change the pattern of care for each racial group. That's the best racial data in the world in healthcare ever. And we invested in Bernard Tyson, who is the president after me. And I insisted that we put that into the database. And that information was breathtakingly useful. But what we had to do was when we identified that the HIV death rate was hugely different by race, then we had to sit down and counsel each set of people and coach and figure out why, and then put in places the things that were culturally sensitive, appropriate to do that. So I'm totally on board with that package. And having said that, I know that Hispanic families with books, 60% are learning ready, and the ones without, 30% are learning ready.
And
that's just amazing, but everybody thinks, people think that's irrelevant. We have to look at outcomes here. We have to look at real world outcomes and not be ideological.
Yeah, and I think George was
real
saying
world outcomes for a very long time and a really serious level, and I know that that is incredibly important work, but that's why we got to get books to those kids.
Yeah, and George, I think there's some, what I'm hearing from some commissioners is wanting to look at that in relation to how learning readiness is being defined in those cases, and not to say that there isn't a there, but that there's an interest in looking at it more closely and
right. But I'm
internalizing it a little bit.
Yeah, and what I want to do is debate that point, because what I know is that the families in healthcare, we give vaccinations to people, and the vaccinations save lives. And we don't look at all of the other social economic issues relative to each patient we vaccinate. We vaccinate them, and it changes their trajectory. And I think this is like a vaccination. And in healthcare, if we look at the social economics, and we should, I've looked at that. I've changed those trajectories, and I can tell you that on this particular factor, not getting books to these kids is damaging children hugely, and people aren't getting it there for what appear to be political reasons and ideological reasons, and it doesn't understand. So yes, but I disagree that we need to look at the total socioeconomic issues on the kids when I know that one factor, the vaccination, cuts the disease. I don't need to know the social economic factors of those families. When I know that having books changes that trajectory, I don't need to know the social economic factors. I need to improve those factors. But
So
that's a different issue.
So Chris, we've got a little list going. So Chris, Jackie, Monica.
Aaron, this is sort of a question for you around process. My hope for this discussion is that we all get to express our opinion, our view, and our preference for the future of the commission's spending on important projects. And what I'm getting confused by in a number of places today is that individual commissioners have raised a preference, an opinion, or a recommendation for the group to consider to be added to this list. And another commissioner has tried to deliberate that or discuss or disagree, and that's fine. But I guess as the person that's helping us with this process, it would feel more productive maybe if we all felt like we could say our piece and have it recorded versus feel that we're going head to head on all these points. We're getting stuck, I think. And so I just want to that's just a process comment. And I think when I hear Shana or Monica or Myra give an important recommendation to the group, I would just really like for all of it to stand, in the record, so we can go back over all of it holistically with your guidance and your leadership. So we're getting to a strategic conclusion.
And I totally agree with that, 100%. Well said, and I am totally on board with that. Let's do that and get the entire discussion there. So yes, that's a yes.
Yeah, so, and maybe just to respond a little bit further on that point, I think we definitely want to hear in this session from everybody and perspectives about desires for the future direction and of First 5 California, and in particular, if we can identify within that items that the staff might bring back informationally or in terms of proposals that the commission then can engage in more in-depth discussion on when those proposals are brought forth. So we're starting off with a bit of an open kind of discussion space, and I think if we want to pivot to kind of either going around or just having kind of sharing with less pushback, so to speak, as things come up, so that we can get those documented and then look at that list and think about what the specifics requests then might be for future meetings. I don't know if that helps clarify it all.
Well, my question to you as the facilitator was, can you please help us with creating a balanced approach to this discussion? Yeah. It's not.
Yep.
And what's problematic is there's a record. This is a public meeting and there's a record, and it's coming out. There are many of us participating here, and the record might not accurately reflect the variety of opinion and expertise that's present here today based on how these deliberations are going.
Well, one proposal in relation to that might be just that we more closely adhere to kind of a speakers list, as opposed to responding, in the moment, so to speak, as many have been. I welcome other specific suggestions if you have them. Otherwise, continuing to make sure that we hear from everybody who is wanting to share. Chris, was that a process? Was the process note, did you have an additional comment, or was it the process note?
I just feel like it's becoming really apparent that we're not getting past a certain way of doing this, and it doesn't feel fair.
Chris, there's one point that I'm talking about and I keep raising. And
George, do you mind if we come back to it? I want to make sure we get to the list here. So Jackie, I think you had a comment or wanted to weigh in, and then Monica.
Yeah, I'll pass.
Yeah, thank you, Erin. I just, in the notes that you're taking around deconstructing what we mean by learning readiness, and then I promise I'll move off of this. But I really want us to really kind of look at the ways, the concept of learning readiness is socially constructed, right? And it's socially constructed to normalize the realities of the dominant culture. And I think if we pull that apart, we can see much more of what Myra was talking about earlier and the other kinds of readiness that Latinx families come to, because we were talking about the statistics there. So I really think that this is a really right place for us to really dig deep and reimagine what it means to be learning ready in a very much asset-based, with cultural humility. In terms of the children and families we serve. So I just want us to really think about that, because I think it's a really rich thing that we could do a lot of data around data with. So that was it.
Thanks, Monica. Camille?
Erin, just to address that, we have been, we had a really rich conversation yesterday, actually, with Myra and Monica on the Research and Development Advisory Committee, but we're also, one of the things we discussed was this definition, or what we look at as learning readiness, really needs to be, it's larger than First 5. It's what does California think about learning readiness? And so as we go forward, this is not just our conversation, but this is where we really bring in all of our partners so that there is a consensus around what it is and then addressing how we go forward. So I think the conversation, I know I've spoken to Janelle. I know that folks with the master plan are talking about this as well. And so I think it will be critical for us as we move forward with these conversations to be inclusive of our partners and how we do that work. That's all.
Thanks, Camille. Others who would like to weigh in on ideas for future work, additional projects that First Five California should be taking on or exploring? Molly?
Well, I have always been drawn to bringing parents together with each other and building bonds between them, in part because I think I do think it's a culturally inclusive and less top-down approach, and also it combats isolation and disconnectedness and depression and just it's hard to be a parent. And I think there's promise in these kinds of programs. I'm not an expert. You guys know I'm not an expert in these programs, but if the floor is open to nominate something to look at, I'm just going to be honest. I've always thought those were sort of promising and interesting programs. They're parent-centered, they're self-help, they fight isolation, they raise up a community spirit. I've always liked them, and so I just am going to put it out there, and because that's what we're doing right now.
Yeah, great, thank you, Molly. Myra?
I have a question about the first bullet, Aaron, around direct services, early learning and care, and self-sufficiency. Could we maybe get like a one-sentence description about what, are we reacting to that, or is that like the bucket of work we currently do? That would be helpful.
Sure, so those were ideas and kind of summarized or paraphrased slightly that were sent in through the pre-meeting survey. Ideas around providing that First Five California might fund direct services, particularly in this theme that has been continued from last month and into today's conversation about focusing on those most in need, and particularly direct services for those who need services that they're not getting, basically. And that might take the shape of early learning and care services, childcare, home visiting, et cetera. But there's also this idea raised around supporting self-sufficiency and family services kind of more broadly. These top three root level bullet points really came out of ideas raised in the survey. So they're there for reaction, for commentary, not a description of current work. Other thoughts, new ideas, and or kind of additional thoughts on what we kind of have up here so far about what First Five California should be focusing on by way of additional or new projects that you might want to explore. Camille?
Just on that bullet around direct services, I'm wondering if commissioners have more thoughts around, like, what do you think about when you think of direct services? And do you know what I mean? Any more specificity around that would be helpful to us. Anybody?
Chris?
Yep. Well, way back when, that was more what all of the First Fives did, right? When you had more revenue and you had bigger fund balances, and it was all very new, there was a way in which the First Fives would invest directly in childcare or pre-K or health insurance premiums that weren't covered by any other funding source. Those kinds of things were home visiting. That was quite normal. And then as things have evolved, we've kind of moved up, you might say, as more sort of investing in systems versus direct services has become like kind of, and public education and advocacy, all really smart, important things to do. But as I think about COVID and I saw the work around supplies and the unmet needs the kids in the state are experiencing because of our budget deficit and not enough money coming from Congress, I just wanted to maybe create a placeholder for us to consider revisiting partnerships with our friends at the county level who don't have as many resources as they used to have, and children are being turned away from programs, essential programs, whether they're health or education programs. And the specifics are, we know that counties have home visiting programs and early education programs, immunization programs, nutrition programs, literacy programs. I think it would be interesting to have a conversation with the network about what is maybe most urgent to learn more.
So as they come forward, Chris, the counties the association's going to be presenting in August at our meeting. That may be one thing. I know there are a lot of them on right now listening too, that we can make sure we, work that into the conversation with them in August.
Yeah, sort of I think just the more we can hear from them about where, say, for example, it's this trickle down. We had a federal budget that came up short. We have a state budget that came up short. Now it's moving down to the county and city level, and they're just starting to really deal with these major impacts to their local budgets. Yeah. So we as a state commission are now probably able to hear how that unfolded and what the ongoing struggles are, how we might partner. I just think we could learn a lot by hearing from them next month. So that's great.
Great. I think just to, and I again don't want to take us way off, but I think Debbie Silverman has just wants to jump in for a minute to talk about DLL and small counties and how we are doing. Hopefully we are working on that as well. So Debbie, I'm going to give you, are you listening to me? 1 minute to do that. You're in. Unmute.
Hello. I've been listening to the conversation, and I'm really wanted to let you know that we've got some pretty amazing projects that have pivoted recently as a result of COVID-19. And I think that is important to note that, in a similar way that impacted our small population counties, have really done an amazing job. I mean, they do an amazing job just focusing on the children and families in their county, but they are reaching 54%, according to our annual report data. They are reaching more than half of children ages birth to 5. And in recent conversations that we've had with the counties, they are finding such innovative ways to reach families in these rural communities, in these frontier communities, in this age where they barely, some of them don't even have internet access. They are figuring out how to help their families overcome the effects of COVID-19. So I want to just point out, Chris, that I think that what you're saying is really very important, but also wanted to highlight some of the really exciting work that is currently going on, and possibly, thinking about how we can build on what that is. We are about to go, we are starting this work group of commissions from small population counties to really think about what are their challenges that SPCFA funding has helped them to overcome and what has really worked. And we're thinking about this in a sustainable way because we know we're all declining revenue and that we can't necessarily keep funding at the same level or augmenting in the future. We don't know what the future is going to hold. We just don't. And so how can we make sure that they have the capacity to meet the requirements of the Act? And so I just wanted to say that in many different ways, we are not only looking to the future in terms of how can we help counties meet those direct service needs of their children and families, and that's just small population counties. But I also wanted to highlight the really great work that's going on right now. The other thing I wanted to say also in the idea of pivoting in the moment because of the crisis that we are in right now, we have approximately 11 million of the 20 million that the commission approved for the dual language learner pilot that has been refocused specifically to help children who are dual language learners who are most impacted. I mean, they are in the group that we've been talking about, the children who are immigrants, who are Latinx, who are most affected by this crisis, to maintain their continuity of learning in this crisis. So counties have the option of professional development that is in a new method of delivery, or family engagement, or child-specific services. But in anything that they do, there are three things that must happen. One is make sure that they're engaging the families, in particular the families who are in the greatest poverty. Number two, they must focus their efforts around COVID recovery. So as the system, the early childhood system rebuilds, that those children are not left behind. In fact, in those rebuilding efforts, dual language learners are front and center in new policies. And so we are working with Early Edge California to really think about what are the policy implications of the expansion activities that will be going on through the dual language learner pilot. And Chair Halverson, you'll be happy to know that any county that's accepting our funding must include book distribution as part of its strategy. And those books must be in the parents' home language and focus on ensuring that children have cultural pride, really taking a look at how families can lift up that home culture through literacy to give children the step forward that they need. So I wanted to make sure that you as a commission understand how these two really important projects have pivoted as a result of COVID-19 and your conversations that have happened over the last couple of months. Thank you for your time.
So as you can tell, Debbie is not passionate about her work, you know, or doesn't care a thing about it. So, but she along with the rest of the staff are doing some amazing things and so I'm glad, Debbie, you had the opportunity to share that.
Thank you so much.
Thank you for doing that. And getting the right books is also really important, both the books that are culturally appropriate, and also there's some really good books coming out about racism now for very young kids that are teaching how to deal with racism, appreciate racism, and avoid racism. And that set of books needs to be worked into the supply chain as well. And other quick point at the macro level, this is going to go on for a very long time. A year from now, we're going to be in big trouble. Like, the counties are going to be in trouble. The states are going to be in bigger trouble. We are going to be in a mess more than a year out. So we need to look at the resource and identify how long it's going to last and how we're going to be able to stretch it out, because we're going to need to stretch it for a very long time. And at the end of that time, things are going to be really hard anyway. So there is no easy landing. This is a really ugly, ugly, ugly virus, and it's going to do some bad stuff for a long time, and so we need to plan for the long haul.
Yeah.
And to that point, if I can just say to that point, that the both the DLO pilot as well as our home visiting work that we're doing emphasizes collaboratives, as does Impact, I know. The idea of communities coming together and thinking about how to maximize their resources and leverage one another's resources so that we are engaging in this continuous improvement cycle. So I heard that brought up earlier, and I just wanted to say that that is front and center in all of our work.
And it can create an opportunity. COVID actually creates an opportunity. I mean, World War II, the Dutch ended up with total isolation for a couple of years, and they didn't open the schools, couldn't go in the streets. So they did nothing but raise the kids in their homes, and they had a lot of books in those homes. And those kids actually ended up with higher IQs and literally a different metabolism epigenetically as a result of that opportunity of having that direct interaction with parents. If we have the right tools in the homes and we coach the parents right, this is actually an opportunity for kids to do better and families to do better. This doesn't have to be all bad. This can actually be an upside. If we do this right, steer this in the right direction. I was just talking to the Zero to Free national agenda, and they're going to try to work that into their messaging because they said, holy cow, you're right. We could think of this as an opportunity to interact in a different, better way and strengthen the kids, not damage them.
Yeah,
So
George,
go ahead. Melissa Stafford Jones from the association also has her hand up. So just want you to know that, Erin.
Thank you. And Myra, I see your hand up too. And George, I know we keep, you're bringing us back to books a lot, which is I understand as the kind of central point that you're coming back to. And I think happy to expand on that here in relation to that as one of the items on the list, but want to make sure that we also are able to kind of get into some of the other topics and give them due time. So maybe we can go to Myra and then we could go to Melissa if that works. Yep. Okay, Myra.
So I'm just going back to the potential ideas that we could put on the table. So one, I would want to call out, given our strategic plan and our priorities, potential mass education around child health and well-being, whether through a public relations contract, communication campaign, all of that. I think that would be amazing. And then building on Chris's point about finding opportunities to leverage county initiatives, I'd love to see us do the same around the state and our agency partners and finding ways in which we can build some sort of interagency task force that requires a specific focus on early childhood development. Now that early childhood programs will be moving over to the Department of Social Services and there'll be a new deputy director, there's a real opportunity to leverage that infrastructure and prioritize early childhood development across the board. And I think First Five can lead the way on that, given our semi-public independent role. I think that's tremendous. I also think, given the conversations we've been having around racial equity and the importance of continuous learning as individuals as well as organizations, can we potentially have a learning item on the agenda at every meeting where we hear a speaker that focuses on early childhood equity topics? We've got great researchers in the Children's Equity Project Network. We've got amazing folks here in California that can speak to, discipline, alternatives to discipline and the disproportionate impact on Black children. They can speak to Latinx communities and family value. You could do anything, right? But it demonstrates a commitment to our learning. And then with that, we talked about this as part of the Research and Evaluation Committee yesterday. Our First Five Summit presents an opportunity to engage the entire network in a potential learning journey around equity and specifically focusing on equity throughout our programs for that summit. that would be something that not only does a one-time investment in this work, but could also open doors to more long-term projects that we could commit to moving forward.
Thanks, Myra. Should we go to Melissa?
She should be coming up.
Okay, great.
There you are,
Coming in.
Melissa. She is.
I'm here again. Thank you so much. I really appreciate the opportunity to share a quick thought. I say I'm a public health person by training, and so I'm really appreciating the comprehensive discussion on the social determinants of health across sectors, across economics, education, family strengthening, health, particularly at the systems and structural and policy level that are so critical, centering race and centering equity in this conversation that we're having today. I just wanted to follow up on Commissioner Perry's comment around counties having largely moved towards systems change work, which is correct. I want to just share one thought, which is we really see a positive interaction between that work with, rather than being juxtaposed as opposites, really the systems change work resulting in improved programs and direct services. So really seeing them as working together, and that part of our work, not only as counties, but really as a network together as the state, both the First Five Commission has been mentioned, you know, a broader sort of view of state programs and partners, and the counties and local First Fives as really having an opportunity to come together and collaborate on that kind of work, bringing it all together toward our shared goals and with the shared values that we have. And we've really seen a positive result from that, that sort of interaction and integrating when we think about, for example, doing systems change work to improving home visiting and the way in which that has improved overall home visiting programs and their impact on families. And in terms of achieving some of the change that was talked about earlier this morning. And then the last comment I just wanted to share was the reflection that I know we're all working our way through right now, which is how really the reality of the impact of COVID-19 just is our new reality, and it is our work, and that is our new context, and that as we all work together to work on these issues for our most vulnerable children and families, particularly our Black and Brown families, our low-income families, that I think this is our new reality of COVID. All that work and thinking about it in a really integrated way is going to be a real opportunity, I think, for our partnership and for the network to work on together collectively as we go forward. And thank you for some of the suggestions for August 19th. We're looking forward to being in further dialogue with you then, and we'll take those requests for us to speak to some of the issues that have come up today and be sure to focus on those for the discussion on August 19th. Thanks so much.
Thanks, Melissa.
Aaron, we also have a comment from Fabiola Gonzalez, who is the Fresno First Five.
Great.
Fabiola?
Yes, how are you?
Good.
Let me see if I can turn my camera on quickly. Can you see me?
Yeah, now we can see you. You're good.
I think I'm a little off here. Give me 1 second. I wanted to just quickly, and I know that you are on a time crunch, but I wanted to build off Melissa's comments. I've been listening intently and really excited about the conversation. Like Camille said, I'm the ED for First Five Fresno County, and I really applaud the Commission's renewed focus on equity and how dollars are invested in the desire to serve our most vulnerable babies. And I want to just express that as you look to continue discussing ideas for additional work, I'm here representing the many partners that you have in all of us as local First Five commissions, like some of you have been bringing up. And in Fresno, you know, changing the odds for our most vulnerable babies has long driven our work. The deep inequities that we see here in the Central Valley spur much of our commission's programmatic investments. And we have used that as catalysts to fundamentally look at how public and private early childhood systems deliver the services and the care for families with young children. So we've been very mindful of those partnerships. We know that some children are being born into families that need more supports than others across the state, and local First Fives figure out ways to step in. One example I wanted to share with all of you is birth disparities, like you have mentioned, especially among our African-American families. In Fresno County, Black babies are dying 3 times at the rate of other babies. And also Black babies are continuing to be born preterm, which is before 37 weeks, at twice the rate of our white babies. And however, access to respectful prenatal care, delaying preterm birth, and preventing infant mortality, let alone supporting new moms postpartum. It's not a simple solution. It's not just one solution, and it's definitely not just the first 5 being able to step in as a commission. One way that we locally have jumped in is by working alongside other cross-sector partners to think about systems differently, to think about how local commissions and state agencies and CBOs can come together to address this as an issue for our entire community. In this case, we have partnered with UC San Francisco, Fresno State, along with local CBOs to offer a concept of group prenatal care that addresses the need for more support and connection among our most vulnerable moms, while also connecting them to wraparound services like childcare for the toddlers that may need childcare while the mom is attending their prenatal session, and healthy food options. That's one option, that one effort that we're doing in partnership with others. And the other that we're doing is a Best Baby Zone. We're one of the investors in that local initiative here in West Fresno, where many of our African-American families live. And that aims to increase support for families with young children that build upon the inherent assets in that specific community and in specific census tracts where preterm birth and infant mortality rates remain high. And in the process, we're also collecting data to better understand how to mitigate these experiences. You know, I share these examples to illustrate just a few things for the State Commission. One, First 5 Fresno, like many of my First 5 Network colleagues, have been dedicated, not all of us, have been dedicated to address the inequities across health, human services, and education, because as you have been bringing up earlier, the Children and Families Act says that we are created to make sure that there is an early childhood system of quality and effective services that together in every county should ensure that children are healthy and ready to enter school. And we are currently, bracing with our communities for the impact of the twin pandemics, COVID-19 and systemic racism. And as the State Commission looks to address inequities experienced by vulnerable families with young children in California, I speak for all of us when I say that we welcome the opportunity to be a resource for what is working across the state and to share what is happening in our communities. I think I also speak for all of us when I say that we count on First 5 California as a key partner in directing resources to support statewide and county level efforts that can address these multifaceted challenges that our families are currently facing. And I just thank you for the opportunity to speak today.
Thanks,
Thank you very much for speaking.
So I might suggest by way of process for our remaining time here that we look at this emerging list of notes and certainly welcome additional commissioner ideas on either refining these or new items that are not yet listed or have not yet been discussed around First 5 California's future investments, additional and new projects. And then suggest that we maybe go through this list and see if, and if so, what are the more concrete follow-up items or next steps in order to move some of these things forward. Some of them already have connected with some concrete next steps, such as informing the next month's presentation by the First 5 Association, but others are maybe at a higher level right now that we could think about whether there's a needed follow-up action at this point, and if so, what that should look like, and you all providing some guidance on that. So maybe just take a minute and see if, I don't see any hands up right now, but certainly welcome other ideas on additional and new projects to be considering. I'll kind of scroll through this a little bit. Myra?
Yeah, there's no shortage of ideas, Aaron. So one thing that I've raised with Camille, and I've talked to folks here, is I'd like to see a collaboration with the Mental Health Services Oversight and Accountability Commission, particularly around early childhood mental health. The Department of Education is supposed to release new regulations on early childhood mental health consultation. What is First Five's role in that? How is the First Five network a part of that conversation? So it's obviously already a priority for the legislature. How can we take advantage of that opportunity? In particular, thinking about the traumatic experience of COVID-19 and not being in early learning centers, not having the social interaction, what that's doing to our the brains of our babies and toddlers. So would love to see something like that. And it's already underway. I know Camille's connecting with Toby, and hopefully something will emerge from that, but wanted to share it here and make sure that we are thinking about the mental health and well-being of our young folks.
Okay, thanks. Jackie?
I'm sorry, I couldn't find the raise your hand function. I don't have a particular idea to add, but just a thought around process. And maybe I do have an idea, but it's really around what Myra was just saying in the trauma-informed space. You know, I was taking notes earlier and just thinking, you know, as we think about, you know, dropping books in the living rooms of all families, I don't think it's resistance. I don't think parents resist a book, but I think there's so many barriers that we aren't seeing in terms of what do I do with this book, or what do I do with this diagnosis or this treatment or this support that's been thrust upon me? How do I use that to the best of my ability when I, you know, have troubles reading and comprehending myself, or when I'm, you know, a victim of domestic violence. And so, you know, while that's not all of our families, and it's certainly not all of our low-income families, I would just like us to think about how to make our supports and our services palpable for those folks that are experiencing barriers in the trauma-informed space. We talked about, I don't love it, but this idea of twin pandemic that the last speaker just shared, that's very telling, right? Because when you think of twins, you think of these two things that are inextricably linked. And they really are. And as we think about, again, our supports, I just want us to continue to be thoughtful, as I really feel like we have been in, you know, uncovering a lot of these pieces, but not just what, but how. Not just when, but, you know, what's the timing that impacts, you know, our audience in the best way for the most optimal impact. So it really wasn't a thing other than I think that trauma-informed space is really important now. But I think the thing that makes it most important is because the folks of us that are doing it are just having to think about our audience in a different way. It's causing us to expand and broaden our thought. And if anything I've said here today, that's all of what I'm saying is, let's broaden instead of looking at that, yep, we need healthcare, yep, we need books, yep, we need, but how? And how can we, because we can check off a box and say we provided the financial resources for it, but can we check off the box and say it really helped a child, it really helped a family, it really helped the community?
Well said. I totally agree. Yes, absolutely.
Thanks, Jackie. Jana?
Yeah, I just want to, I really appreciated what Molly said about parents, and I heard a little bit of that sort of in what Jackie shared and others, but I think across all of these, you know, this entire list of things, really thinking about parents and families, and that, yes, the end goal, right, the outcome we seek is related, you know, to children, but that some of our interventions may need to be more sort of parent focused. And so I just want to really, really underline that, I think, particularly now. So didn't want to lose that. And I don't know if, you know, what Molly suggested is the right or the wrong thing, but I think that parents thing is really, really key.
Thanks, Shana. Other comments, Molly? Molly, looks like you're still on mute there.
Okay.
Now I got you.
And can I, sorry,
I like,
clarify, sorry, I just see, so it was added, what I just shared was added as a sub bullet under there. I think it's more meant to be sort of infused throughout.
yeah, it's an umbrella. Yeah, I agree with that. But I particularly like what Shana said about especially now, because to the extent that we have historically thought about programs, and we have thought a lot about programs and delivery of services and delivery of programs, the COVID has atomized our parent group and forced people back into their houses, and they're not going out, and they're not seeing each other, and their children are not going to daycare. And I have to say, one of the reasons that I have been a big supporter of books this summer, like right now, let's do this, is because I keep thinking about the children being at home and kind of stuck there, and how healthy and good it would be to get books into the houses, to build that parent-kid bond and to get the inequity down. I just see these inequities growing. If you used to be in childcare, at least when you went to childcare, people were talking to you about letters and numbers and books, and you saw them. But if you're at home and you're not in a family that has books, and the heart-tearing thing is they may not have books because they don't have food.
Right.
They don't have, they're food insecure. They're not going to be able to buy a book. And I just hate that idea that some people can't have a chance to prioritize books or literacy for their children. And so, you know, I would love to see us try to do something about this. And I've been very happy that we've gotten the books into the shipments with the supplies, so that on our emergency work that we've done, we've included books in getting out there. As George says, this is going to go on for a longer time. And as we continue to think about, you know, what to do while we're still in this mess, this pandemic mess, whatever we decide to do about literacy and books long term, I would love it if we did something to continue getting the books to the kids who need it most, to the neighborhoods who can benefit most, who are the most barred from even the option of having books by the economic and social impact of the COVID in their neighborhood. I don't know how, and I don't know, and I know that Jackie says, you know, what is the how? And Jackie, I don't know how. You probably know how, however. Well, you probably have an idea. You have a better idea than I do. Any event, I just think if, you know, we should just try to figure this out, is my plea. Let's figure it out and do some good with it.
Francine Rod, the executive director from Monterey County, who has her hand raised. Francine?
Good afternoon, commissioners. Francine Rod here, yes, from First Five Monterey County. And I wanted to invite you all to join us on a journey that the First Five Association is embarking in. Camille and a couple of staff were able to participate in our first kind of foray into this as a network yesterday, which is something that we're kind of talking about in the way of looking at readiness in a different way. Instead of READY, we're thinking of it as our systems really ready, REDI, and that really stands for race, equity, diversity, and inclusion. And so it gets to what a number of you have been talking about in terms of the how, is how are we individually understanding our position related to race and our racial identities? How then are we as a network really looking at how we are implementing the programs that we are providing right now so that they are creating a sense of belonging for everyone? And then how are we really including the parents and the providers and the design and the development of what it is that we are implementing in the communities. And so I would, posit that that might be a how to some of the things that we're talking about in terms of the programs. And I know we as a network would really welcome the opportunity to design some of these things together with you all before they get too far down the road, and look forward to talking with you and learning about what your underlying desires are, and then also from our experience of what we've been able to implement in the field. So thank you for this conversation and for the opportunity to work together to build a cohesive, collaborative system where we are centering race, equity, diversity, and inclusion, and really making sure we're ready.
Thanks, Francine.
Well said.
So we've got just about 15 minutes left, and so I wonder if we can pivot a little bit to be thinking about those kind of next steps. Not that everything on here necessarily needs one, but if there are follow-up actions that you all would like to see in relation to some of these ideas, now would be a helpful time to clarify that together, think through that together.
Quick comment. The state librarian has asked us to help getting books out to as many 0 to 3, 0 to 5 kids as possible. And Tony Thurmond, who's the superintendent of schools for the state, just texted me this week, and he really would like us to help him with learning readiness, because he would really appreciate it if First 5 could use some of our resources to get books into the homes, because he knows that he has no chance of changing those learning trajectories unless the kids are ready to learn when they get to school. And so Tony was very, very clear on that, and he would be delighted to be part of a coalition on that. And the thing that I would like to suggest for the next step is to follow up on what we just heard in terms of bringing together interested parties who want to do this as a coalition and a collaborative, and have that include the First 5s, and then also throw into that the superintendent of schools and the state librarian, and really make it into a literacy collaborative that we steer and lead. So if we could steer and lead a literacy collaborative, and they really want that to happen. Tony Thurmond totally understands that he can't change the learning gaps, and he can't deal with the equity issues. The other point I'd make is it makes me crazy that the average white family has 12 to 20 books. In the average Hispanic, over half don't have a single book. And equity, that is just wrong. That is absolutely wrong for the kids. And whether other things are part of the package, that particular part of the package is something that if we have the opportunity to change, we should change. And having white families with that many books, enjoying them in the COVID isolation, reading every day, and having the other families not able to read. And I'll end with Little by Little has been continuing. We fund Little by Little through First 5 money in LA. And they've been giving books out through WIC, and they have figured out how to continue to distribute books. And what they report is the families with books are really, really happy to have those books. They deeply appreciate them. The parents think it's one of the wonderful things, and they feel good about it. And so if you're talking about how do parents feel about it, we don't have to ever force a book on a parent. The parents love it, and they feel good about it. So, but I would suggest as next steps that we figure out what does that collaborative look like, and have Camille put it together and steer us down that path.
Aaron, I know we might want to go back to public comment just to wrap up. That into your time. I think we have at least one more person who would like to speak.
Yes,
great. Thank you. Yeah, let's. And I think if we could spend a few minutes on next steps and then come to that as we end, if that's okay, then that's my suggestion. So to just go through here on this direct services idea, it seems like having some sharing of information from First 5 Association at next month's commission meeting on this in terms of what they're seeing a need for at the local level. as the primary next step that's going to come out of that. Chime in if there are others as we go through. We just talked about this as the next step for this books and literacy item to think about what a collaborative might look like around that, and what might be necessary to make that collaborative form. We didn't talk a lot about one-time kind of system investments, so no specific next steps coming up there. I wonder on this learning readiness as it relates to defining it, and defining it more broadly than maybe it's been discussed so far, than we've clarified how it's being defined at this point. What you all see as a way to get started on that, or a next step that would help the commission in getting to that definition, shared definition.
Yep, and let me throw out a quick comment on that. We don't need to have a massive learning readiness assessment of every kid. We just need to have a very short list of very important things that a majority of the kids can do, like count to 20, to say the alphabet. When you go back and look at all of the learning readiness studies, one of the things we know that in California, for Hispanic kids, only 15% are able to count. And you look at those numbers of the low income, the data that we just sent around said that the learning, 15% were passing the learning readiness numbers. So what we need to do is we need to have 60, 80% able to count to 20. And then that will spill over into the rest of the readiness. We don't need to do in-depth assessments. We just need to have, if people know the alphabet, know some basic colors. I mean, the levels are so low on some of the literacy stuff that many of the families are doing incredibly well. They're doing great stuff with the kids, and others just are way, way, way behind. And we just need to help the kids who are way, way, way behind.
Monica, and then Molly.
Erin, can I come back to your question, Erin? I think I would love, as we try to really redefine what learning readiness is, I think some work that the Monterey County and Fresno, I think the associations doing some on the ground might be able to really help. And there is a lot of scholarship out around.
Monica,
Sorry,
sorry, your audio's, I'm not sure if other people are getting this too. Your audio's breaking up just a little bit for me. But
sorry.
What I was getting just to confirm is that I think First Five, say Monterey and Fresno, had been doing some more work in this area.
Them because they both told today about some of doing in terms of redefining this. So I think some of our partners might be able to really along with really kind of looking at the scholarship, because things that we're using learning readiness are so as I've too, but I just want to get in there on that document. Our county will be able to help us really differently readiness means.
Thanks, Monica. I think I captured it, but let me know if I missed it here. Molly, did you have a comment here as well?
Well, I think that Monica's suggestion is a good one, and that will help address my concern. You know, I'm very supportive of George and all he's done in his life and what a good leader he is. George, sometimes when everybody says, you know, the deficit model is not really working, it's not landing right. Yep. And that's, I think, I share that concern. I mean, I really do. And so I'm interested to hear, what is the thinking on learning readiness? I'm going to say, as a civil rights advocate, I am aware, painfully aware, that deprivation of the right to read was one of the biggest elements of the initial structure of racial oppression.
Yes.
And and so I feel very strongly about reading, because I've just soaked in this horrible history where, you know, they burn out the school teachers when they come to try to teach the kids to read, and they make it illegal to have a book when you're in slavery, and all this horrible history. It's like, so part of structural racism is about books and literacy, at least in my mind. But that doesn't mean that my white lady mind is, you know, doesn't need to be shaped and educated by concerns of, you know, people who really have lived this in their bones. And so I kind of, I'm very sort of moved by the whole conversation all over it. I understand what everybody's saying. I understand that George's strong feelings, but I understand that what he's saying doesn't always land right. And I do think that having some presentations of the sort that Monica is talking about is probably healthy. We don't want to seem like we think that, you know, these kids are wonderful. I mean, the cultures that the kids bring are amazing, and all the work that was done to, you know, to document the strength of the Latinx families. And, you know, would somebody please document the strengths of the Black families? I mean, we always talk about them like they're so troubled, you know, and they're just the most resilient, incredible group of people ever, given what they've been up against. So, you know, it does, the deficit model does bother me, and that's my little, I'm going to stop talking so much. Sorry.
Thanks, Molly. Comments? Couple more things here that can just cruise through in terms of identifying any next steps that we do want to note down. So a couple of items related to kind of parent services or programs focusing on parents. There's one idea of peer or parents connecting with other parents, and then kind of a broader suggestion that we think about being more parent focused, especially in the context of COVID-19. Any next steps specifically there, Jackie?
I'm sorry, I don't have a response to that question yet. And I'm trying to make sure when I'm speaking, there's a value add, not just to talk or to rebuke something. But I really wanted to thank Molly for saying that. In this commission, we don't really have an opportunity to talk offline out of respect to the process. But I can't go through another meeting without saying this. It is critical to me that we not work in the deficit and not portray African American and Latino children as unsalvageable. And sometimes the constant repetition of those statistics, which some of them I just don't know to be true, but it doesn't help the conversation. I believe that we are all here because we are painfully aware of those statistics. And as it's been said many times, we all truly appreciate the importance of reading, and that's not the end of the story. That's part of the story, and it's part of the solution, but it's not the entire story. And, you know, I just want us to be effective. I want our meeting, we've spent a lot of time here today. I think we had a lot of great conversations. I did a lot of learning because I wanted to really listen and understand. But I just have to call out, because there's no other opportunity for me to do that, how disruptive I find that to be. Not just for me as a professional, because I can handle that. As the lone African American in most of my forums, I got a lot of experience with that. But we have 70 other people on this call, or we did at one time. And I think it's important as a commission that we be really cautious and responsible with the things that we say, because in many ways what we say kind of becomes law, or it becomes the statistic that somebody goes out and repeats. And I just wanted to call that out because I want us to be effective. And I find sometimes an inability to be effective because of that, that narrative.
Thanks, Jackie, for sharing that. Just putting up the rest of the list here. I know you know, I'll take a quick look to see if there are other next steps. I think it's fine, as I've noted, that some of these things be at a higher level and things that maybe we continue to carry forward in terms of overall direction and not have more concrete next steps if that's a better place for that, better level for them to live. I think there are a couple of specific ones already here, kind of thinking about learning items on commission agendas moving forward as something that's very concrete. And then thinking about the a shared learning opportunity through the First Five Summit for engaging the entire First Five network of state, county, and association on issues particularly around equity. Other specific next steps or kind of requests for action? I know it's an informational item, but as we think about how these things might be moved forward, anything else that you all would want to add before we go into closing out with some public comment?
I appreciate that feedback, by the way. I tend to be extremely aggressive in my data sharing, and I really desperately want every child in America to have a wonderful, wonderful life and to grow and blossom. And I've seen children from every group. My grandchildren have ancestors from both Mexico and Africa. In my own work with my own children, it could not be, I mean, it's very personal and it's very immediate, and I love these kids desperately and really care about them. And what I know is that kids from every group, when they get exposure to those kinds of interactions, blossom and grow and become magnificent and have a great time and love it and feel good about it. And it's all about these kids really being wonderful and everybody being above average. And we need to get to that point, and I really care about that. That's what I want. And so when I phrase it about how bad it is, because I'm really angry that the minority families have no books and the white families have books, it's because I want those kids to blossom. I want them to do magnificently and to have wonderful lives, great lives, much better lives than they will have. And racism is, I've been writing about racism for a long time. I wrote about racism, my first newspaper article 20 years ago for the Wall Street Journal. I talked about Black students who couldn't rent apartments. I mean, I literally have a track record of being on this path for a very long time. And that it is all about, we as a country have done racist things that have done horrible things to people for a long time. And I want that to stop. And I want to help every kid. And so it's about helping every kid. And so if I phrase it in a way that seems at all critical, I love those kids. I love my kids. And it's not about being critical of kids. It's about wanting them to have a great opportunity. So it's not in any way, I'm not being critical, I am being loving. I really, 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 really want all kids to thrive and to do well. And I think kids can't thrive if they're isolated. They can't happen. So that's what it's about. But I really think, but I clearly say that very badly. And I'm kind of pushy in what I say. And I've been CEO of 7 companies. When you're CEO a lot, you get certain styles of communication. But I've also been incredibly inclusive. Kaiser Permanente had 8 regional presidents and only 2 were white males. And the person who succeeded me as the president was Bernard Tyson. He's African American. And the person who succeeded him, Bernard, my good friend, just died. And he was succeeded by Greg, who is African American as well. I had so many levels of African American senior leaders that Bernard could pass away and be replaced by somebody else. So on racism, I could not be more committed to making that whole agenda work in the right direction. And there was just an article written that was the first multi-billion-dollar company in America that had a Black president followed by a Black president. And I promoted Greg to being group president, and Bernard promoted him to be EVP. But anyway, racist, and I'm not being critical. I'm just saying it very badly. Anyway, I apologize for that.
Thanks, George.
Yeah,
Camille, should we go to our public commenter here?
I think so. Do we have Monique Segura? Monique Segura?
Great.
I think she's here. Oh, there she is. Hi, Monique.
Hi, my name is Monique Segura, and I am a liaison with the California Teachers Association. And first, I wanted to thank First Five for all your hard work during this time. And I know all of your hearts are in the right places, and we appreciate all that you're doing. I wanted to just extend out, as we were going through the collaborative part, CTA is very interested in getting books into our youngest children. As you know, we've been doing distance learning, and books are not getting to our children because they're not in our classrooms. And distance learning, you know, we're doing what we can, and it's a great outlet, but our youngest children need books. So please, moving forward, if you're really getting that, please reach out so that CTA I can get some things for us to be part of that collaboration to get books, especially with systemic racism, and getting those kinds of books into the hands of our children. And the other thing that I just wanted to share with you, I'm a kindergarten teacher. So I've been in the trenches here doing the distance learning, and then revving up to do it again. One of the things that I really would love to see, and maybe you're doing something like this and I'm just not aware, is First Five doing some kind of campaign that deals with text messaging to our parents. I found out after 27 years of teaching, the best way that I was connecting with parents on a daily basis was through a text messaging system that I utilized called Remind. And it was one sentence that went to my parents, and I have never had the engagement that I have had and the knowledge that I had about how my parents needed my support and my help, because this generation parent uses texting. That is their venue, that is their livelihood. So just wanted to share that thought. And also, again, thank you for all of your work. And Camille, I think you have my contact information. If not, I will make sure you have it. But please keep CTA in mind, jumping on with you guys for this collaborative effort on getting books in the hands of our children.
Thank you so much. Thanks, Monique.
Thank you.
Good luck with the start of school.
I know, I tell everybody, may the force be with us.
That's right. That's right. Yeah. All right, Aaron, I think we're good. Are we good?
Yeah, I think we are just winding down. Thanks everybody for hanging on a few minutes after. Shannon, if one moment come to you. Just want to quickly take a look back at our objectives for the day. I know there's much more work to be continued through the future meetings. I think we landed with a number of ways for the direction from you all to kind of be progressed in a concrete fashion. There's just one more that I wanted to note, which is I know that the staff is also working on revising, refreshing the ways that items are presented. Particularly proposals are presented based on some of the feedback that you all have provided. Shayna, do you have a closing comment?
Yeah, and it's not specific to the budget conversation, but I am wondering, Camille, if there is a way to make explicit, I think the consensus that, was expressed around really moving from a deficit model to really focusing on strengths and assets. And I don't know where that needs to show up, but I think to really explicitly call that out is really important, and that's the place where we're operating from. And so I don't know if it gets added on as in this strategic plan and something, but I don't want to lose that.
Thank you. We will. Okay. So first of all, can we just all thank Aaron for helping us get through the day? Thank you, Aaron. Nice job.
Yep, well done.
So thank you so much. Thank you, commissioners, for hanging right in there for these conversations. They have really helped us. with how we go forward and the work we are going to do. Like somebody said, there's no, I think it was Myra, there's no shortage of a list. And, you know, we have plenty to think about and to do. So we appreciate that and thank you for that. Just to say, August 19th, put it on your calendar if it's not there. That's when our quarterly regular meeting is scheduled for. So we hope we see you all there. And with that, we hope you have a good month in between and you all stay safe and healthy.
And this is an official meeting, so I need a motion.
Yes,
to adjourn.
that's right. Sorry.
So yeah, do not close it without the. Would
You're right.
You want to continue on, or would someone like to move that we adjourn?
Oh, I think that's a good move.
Is there
Move to
a-
adjourn.
Move to adjourn. Is there a second?
A second.
Moved and seconded. All in favor, say aye.
Aye.
Opposed? No opposed. We are adjourned. Good meeting. And I really do need to figure out how to express those points more effectively, because I really do care deeply about that topic. We got to get it right. We need to help every single kid in America, born in America. We owe it. We've got way too much money not to help every kid. And at a time of COVID, kids need our help even more. So we've got to figure out how to make that happen. All right, be well, everybody.
Thank you.
Stay well, stay safe.
Bye-bye.